Hello,
Hello. Hi.
how are you?
I'm good. Thank you. How are you?
I'm good. So I just started like maybe 3-4 minutes early to see the connection and camera and all.
Yeah, makes sense. It's pretty okay.
Okay, so you can hear me, right? Fine?
Yes, I can. I think I still just put on my earphones.
Yeah, okay.
Yeah, better.
I think we just wait for a few more people to join.
Yes.
So what time do you get off work?
Usually my shift is 9 to 6, so by 6:30 I should be home. Today I came a little early, and then I was just prepping and all that. Yeah.
It's going to be a fun session. So I'll just give you,
Yes.
I know I already told you, but
Yes.
just a statutory warning, there is no time limit to our
I
sessions.
know. Fully charged phone, and my charger is right next to me.
That's amazing
Yes.
because we can go on and on. I think, in the last session, had Fifi's battery not died down, we would have continued more. We
Oh
were in
my
all the
God.
flow.
So I
So her
kept,
phone's battery,
yeah, with her session, I kept popping in and out. And I was like, oh my God. Like, I think it all went out till like 9:30, 10, right?
yeah,
So
9, 9:45. Yeah, it was
yeah.
easily like 1 hour 40 minutes or something. No, 1 hour 30,
Ha.
25 minutes. That long it went.
Yeah. So what do you do? I don't think we've met.
No, we have not.
Yeah.
So I got to hear so much about you. I was
Oh.
like, yeah, so many of my friends take their
Ha.
dogs to Dr. Paws, and so
Hmm.
earlier you were in Crown, right? So
Yes, yes.
yeah, so that's how I know you have all, and I've seen you on IG and on their,
Oh,
stories and all. So I thought that you'll be the perfect person to, have this
thank
session
you.
with. Because
Thank
I've
you.
seen like most vets, they're very conventional in their
Hmm.
approach, like especially the ones who are very senior and
Yeah.
experienced. So it's hard to have very, unconventional
Yeah.
discussions with them.
It having open discussions basically is what is lacking, I feel,
True.
in our field. Both like, there's also like this with social media, especially parents have also become like, oh, I know this from this page and I follow this person, so I want to do this. Like
True.
nobody's open to discussing. And then we vets are also like, oh, this person is just following some social media nonsense, so we don't want to talk about it at all. So that is a place where I feel we need to bridge that gap and
So
be like, let's sit
I
down and
think
have a discussion.
I think the best thing is that people, pet parents, because of communities like Instagram, they are getting like becoming more aware,
Yes,
and they have started asking
yes,
questions, which is what I see like most vets are not very comfortable with. So
comfortable with
they
it.
like want ki, if I have told you something, just follow that,
Yeah,
and please don't question me. I mean, it becomes like an ego trip or
yeah,
something. So
yeah,
I feel very happy when I see vets like you who are so open to discussions, and
yeah,
like people can comfortably ask questions because
yes.
it's their dog, it's their child,
Exactly. Like
you know
you have all the rights to know what I'm doing with your pet. Like,
exactly.
and for example, it's funny that once my own cat, because I stay away from home, so that there are two cats at home, and one of them had to be taken to an emergency vet in the night, and just for like she was breathing a little heavy. That's all.
Hmm.
And X-rays were clear, everything is clear. I am on the call throughout for like an hour or so, and still she ended up getting unnecessary
Oh my
medication. And this
God.
was not even discussed. Like, forget, telling that I'm going to do this and you just have to accept it. Nothing. They just gave my dad the bill, and then he was like, what is this? What is that? And my sister was there, and she was like, there's some antibiotic now. And that was like a very high antibiotic. And I'm
My God.
so against using antibiotics, just left, right, center. People use
Yeah,
that.
and luckily because
Yeah.
you are a vet yourself, so you were able to
Yes.
identify that and
Identify.
guide the family. Most pet parents, like, if my vet is telling
Yeah.
me something, I have no clue, and in front of him, I will not stand and Google things and
Exactly. You
stuff.
can't.
Yeah, so it's like you have to decide there and then.
Yeah.
That's why I feel it's very important, for vets to open up and have these discussions at least,
Yes.
because even earlier we also used to be that way.
Hmm.
Whatever the vet is saying, we will
We just
agree.
do.
But once we, spoke to people, got in touch in the community, got
Hmm.
to know things, we also started questioning our vet.
Questioning.
So he laughs a lot ki, abhi kaun sa reel real देखा है. Like नहीं sir, real नहीं देखा. But he's very open. Like he will
Yeah,
always answer, and I
yeah.
generally also question him.
That's
So this is one thing
yes,
that's changing, I feel.
yes, yes.
So
It
I
is, and that's
think
for the good.
a lot
This,
of people have joined, and I think
yeah,
we'll just get started. Anyway, we are going to have a very big session, so
yes,
people will keep joining and dropping in.
yes,
So, Dr. Archana, if you can just maybe give a quick introduction so that people know
yeah.
like whom they are expecting on the
Uh,
session.
so I'm Dr. Archana. I'm a veterinary surgeon. I finished my post UG from Hassan Veterinary College. I did my postgrad from Pukod Veterinary College in Kerala. My subject was veterinary surgery and radiology. Then I moved on to private practice immediately. So first I worked at Cochin Pet Hospital, which is led by Dr. Suraj there. He's also a very well-established vet in Kerala. I was there for about 1.5 years. Then I moved to Crown, which is a very typical corporate setup, but has a lot of like UK inspired technology, like even the diagnostics and all of that. So I was there for about
Amazing.
1.5 years in Mumbai, where basically I kind of moved from just doing surgeries to also looking into medicine cases and interacting emergency medicine and all of that. From then on, after 1.5 years there, I moved to Bangalore, leading the Crown Vet Bangalore branch. I was there for about 2 years. And now I've just moved to Dr. Paws. It's been, I think, 4.5 months now. I'm leading the Indranagar clinic here. It's
Amazing.
going amazing. I have two cats. I'm more of a cat person. I'm sorry. I'm more like
Everybody
a
has their
introvert.
preferences.
Yes. But nothing against dogs. It's just that, I would prefer to just like, I don't know if you can see my cats, just sleep all day, not interact with people much. Although my job is demanding interaction with people. Yeah. Basically, that's about me. Yeah.
So that's amazing. I'm sure people are very excited. As usual, I was expecting it. And so I was
Questions.
bombarded with questions. And despite writing that, please don't ask, like people have started
Specific.
emailing, my dog is having this, my dog is having
Uh,
that. So I had to politely tell them that let's not take this
yeah.
up in this session because this requires a separate
Yes,
consultation with the vet.
exactly.
Yeah.
If I'm able to kind of understand what's happening with the pet with the basic information that they provide,
Yeah.
I think we can still address it. But sometimes it just goes, overboard, and
Yeah,
we'll
because
not be able
anyway, I
to.
think physical examination is
Yes, yes,
important in such things.
very
Like,
important.
cannot be just seen on the camera or
Yeah,
just read and
it's
understood.
impossible.
So I think let's just start because we have a lot
Yeah.
of questions for you. And I'm so happy and I was super excited because I knew this session is going to be something that
Uh,
is going to be loved by everybody. And
Needed.
it's like most sought after things that, small things which we don't have an idea of,
Hmm.
which we should as pet parents know.
Yes.
And coming from a vet, I think it will be very helpful.
Yes.
So the first question
Hmm.
is, which is a very like
Hmm.
common question that people have on their minds. What are the most important preventative care
Hmm.
steps to ensure a dog's long-term health?
Okay, so preventative care, the first things are obviously vaccinations. You have to get your co-vaccines done. As puppies, you have set of
Hmm.
vaccinations that need to be done as puppies, and then every year. In India, it's every year because there's so much, the diseases are so
Exposure and yeah,
widespread. Yes, yes. There's no way you can absolutely say that, no, I'm not exposing my pup to my adult dog to any infections. Because you pet a dog, you come home, you touch your dog.
exactly.
That's transmission of disease. That's one thing, major thing. The second thing would be deworming. Once in 3 months in adult dogs is what is recommended. Pups may, up to the age of 3 months, we say once in 15 days. Then up to the age of 6 months, it's once a month. And then once in 3 months for life. So there are mostly it's oral ones. There are injections, but we're not big fans of injections. This was what was done previously, but it's basically I think ivermectin is what they're still doing on.
Hmm.
But it is a neurotoxin, and it's very easy to go overdosing with ivermectin. So I am not somebody who prefers it. Oral, very safe. Have not seen any bad effects with it. So deworming is the second thing. Third is obviously tick-and-flea control. Heartworms are not major concern here in India. In Kochi, though, we've seen a lot of heartworm issues. But in Bangalore, we've not. I don't know if it's underdiagnosed, but we don't see a lot of heartworm issues. But yeah, tick and flea control is the next important thing. Then you need to make sure that you're also taking care of your dog's dental health. That is something that is missed out very frequently. I
True,
know
true,
the
true.
many people are now kind of concentrating on
Yeah.
it. Like I know people are doing chews, they want to brush their teeth, they want to do supplements. So there are a lot of options that you can explore. So because dental care is not just about the oral cavity, bacteria can spread from. So one is obviously there's dental tartars and all of that that's building. There's gingivitis. There's a lot of discomfort in the mouth, can
Hmm.
lead to teeth infections and abscesses forming. But otherwise also the bacteria can move into other
Hmm.
organs, can cause kidney issues, gut issues, all of that. So these would be the major. Um, I would prefer if parents are doing their regular, checkups with their vets. I think we will be
Yeah.
discussing about that in detail,
Yeah,
like
we'll
how
dive
often we
into
need to.
all
Yes.
these.
Yeah,
So
in
the
detail.
basic gist is that there are multiple things we need to
Yes.
keep a track on. I
Yes.
think most important will be to watch your dog.
Yes.
Like you should
Always.
have an understanding of these things. You
Yes.
know that I have seen some houses where the dog is just
Yeah.
lying around somewhere and the people are somewhere. So that's like a disconnect, and you'll never be able
Huh.
to identify
That's not a pet
things.
dog. That's not
Yeah,
a pet. That's not your
true.
pet.
Like you should have eyes on your dog
Yes.
and be actively involved with
Yeah,
them.
I know pet parents who are like, like she did everything normally, but then she's just not comfortable sitting. I remember once, I think Sparkle's mom, I will take her name. Like, and then there was something stuck in her bum, and that's like
True.
the craziest thing. She was like, no, dog, she's doing all okay, but then I still just want to come drop by.
I
So,
know.
like, knowing the simplest
Yeah.
of things with your pets is so important. That is what differentiates new age pet parents, like
True.
us millennials.
Actually, true.
Yes.
So the next is how often should dogs get a wellness exam and what key health markers should we monitor annually?
Okay, so if it's a young dog, like say up to the age of 6 to 8 years, depending on the breed, we would say the young dogs. So they can get an annual health check. So what I would prefer to do is every time they get their annual vaccination, you can stick to that because anyway you'll be coming to the vet for
Hmm.
that. Okay. So at that point, you need to have a complete examination done of your pet, like a general examination. Along with that, have your baseline values, like have a CBC done, have your basic liver and kidney function proteins checked. At this age, I still you don't necessarily need to have your heart markers and all of that
Hmm.
checked. But this basic blood work, because say 3 years, once the dog is about 3 years old, they end up having some vomiting signs, and then they come, and then we realize that the dog has actually had bad kidneys, and
Hmm.
like those could be congenital issues. So we don't want to be missing out on those. So then I don't know if it was always bad, if it is just now progressed to be bad. So that is one thing. In some breeds, like retrievers, big breeds, like large breeds, retrievers, Labradors, Rottweilers, and all of that, it's important that we also get, when you get them neutered, at that stage, get a hip X-ray also done. This
Hmm.
is something that ideally also needs to be done at the age of like 6 to 8 months also, because that's when they're still growing, and hip
True.
dysplasia, unlike what people have been telling on social media, is not something that the dogs are born with. It's, as you read the definition, it's a developmental disorder.
Hmm.
So as they develop is
Okay.
when this is happening. So get a hip X-ray, but the only thing is that this needs to be done under sedation. If somebody is doing it without sedation, it is pointless because we need to get the angles right. And usually it's a common disease in bigger breeds, right? So they will not be comfortable to lie on their back. So they'll be lying on their back. You're pulling their legs,
Hmm.
twisting their legs. So to get that angle, it's very important that sedation is needed. So you'll need to have a reliable vet who can do the sedation very safely, who's confident about doing sedation, and who you're confident
Hmm.
in. But if you're not seeing, but otherwise, if it's like a very bad case, you will definitely start seeing symptoms early on. Like there will be swaying, the hopping gait that you notice, the way they place their legs will be abnormal. All of those, even during when they come for vaccination, we'll be able to pick up on those signs. If we've not, then you can wait till they get neutered or spay, and at that point you can just add that to their preventative, like wellness care, like what package may with the blood work, just add that X-ray
So,
also. That
like
is
you
something.
said, Doc, that this is like a developmental
Yes, yes.
issue. So, How about like, I mean, if like suppose my dog got spayed
Hmm.
and we got her tested, but
Hmm.
at that time nothing got
Hmm.
detected. So is it possible like later on she can develop it and I might not be able to
Huh.
know? So how often do you think that this X-ray should be done just to check for the?
So her developing something after she's become an adult, like after the maturity of the bones and joints is done, whatever happens later is arthritis.
Okay.
So people use hypnostasia as a broad term because
Okay, got it.
see, people pick up on things that vets say and
True,
then they
yeah.
go on and speak about it, right? So that's what is happening. So later on, what is happening is basically arthritis, like what's something that I could also be getting. Say your pet got neutered. Usually, what happens, they also put on weight. And then arthritis will set in because
Hmm.
there's overweight, the pet will not be exercising, too much strain on the joints and bones and joints.
Hmm.
So later on, that is still arthritis. So that again, once a year when you take your pet for checks, you can also just get a X-ray of the joints if you're seeing any symptoms. Or during physical exams also, we will be able to assess. Like when I'm extending, flexing, hyperextending and all of that,
Hmm.
I will be able to understand if there's resistance. They might not overtly tell you that, no, I'm not comfortable with
Yeah,
this.
but there will be
But
signs that
yes, yeah.
will
Like
denote
beyond a
something is
point,
wrong.
yes. Beyond a point, they might not let me extend. Beyond a point, they might just turn around and try to like, please don't do that. Like
Hmm.
lick my hand, things like that. Those are signs that they have some localized pain in that area. So that's something that we can pick up. Crepitation is also something. This is more common in older pets. Like as I'm moving the joints also, I will be able to feel that as if like a sandpaper is being rubbed. That kind of a feeling will be there.
Hmm.
So that's in older pets. So this is for up to 6 to 8 years. Post that, we consider everybody geriatric. That means to say they're like senior patients. In them, I would suggest at least twice a year. At least once a year, get markers like you. Please do a urine test also because
Hmm.
many a times what happens is kidney disease. Up to like 60-70% of the kidneys damaged, we might not see changes in the blood. The
Hmm.
only change that we might be seeing would be if they're able to concentrate their urine or not. So, a
Hmm.
urine test is going to help you a lot. Okay, with them, you can add that with your puppy and young dog checks also. But it would be ideal. Always, please do a urine check. You can get your SDMA is one marker for kidneys. It's a very sensitive marker. So before I could see changes in other values, I would be seeing changes in SDMA and heart check. So at this point, I would suggest get a X-ray done because obviously sometimes what happens in just dilations, we might not be able to pick up on murmurs and stuff. So a chest X-ray and also
Hmm.
if possible, if you have the access to a good cardiologist, get a scan also done with
For
an
senior
abdominal
dogs, this
scan
you're
for
talking.
senior dogs, for senior
And
dogs.
this
And
should be like biannually, right?
biannually. So
Okay.
young dogs, if they are somebody like a retriever or Rottweiler who are predisposed to having tumors like hemangiosarcoma, then an abdominal scan once a year if possible. That is something I
Hmm.
would suggest because hemangiosarcomas just pop up and like once they start bleeding, it's an immediate emergency.
True.
So these are things that you should be taking care of. This same applies for cats also. I don't think we have a lot of cat parents waiting. But yeah, similar things, but more common to more. It would be wiser to check blood pressure also
Hmm.
in cats because they are prone to having hypertension, and that goes
Oh,
missing very easily.
that's new information.
Yeah, yes, in cats, and they're very good at masking symptoms.
I
Another
think
thing
all
is
animals have like a very high
yes,
endurance,
yes,
and once like I feel that my dog is showing pain, that will
like the
be
yeah,
like when
pain.
it's like unbearable. Otherwise,
Yeah,
I've
and
seen they will just be very
very
okay.
okay. Like even if they're in pain, they will be
Yeah.
walking and all of that. That's why when somebody comes to me with a limping dog and they say, "Oh, but I don't want to do medication," I'm so pissed because
God.
I'm sorry, but your dog is in pain. That's the reason they're showing it. Like otherwise they would
Exactly.
have they're in extreme pain, otherwise they would hide it.
Hmm.
So this fear about medication is something that really needs to go. And
We
just be
will
open.
touch that topic.
Yeah,
I'm
yeah.
so excited for that because
Yeah.
this scaremongering is going crazy.
Yes, yes,
I mean,
yes.
I
It's
understand that
so
holistic
bad.
wellness is important and, natural, however you can manage it naturally, that's important. But it's not everything. I mean, you
It's
cannot
not.
replace veterinary sciences with like
You
these
can't.
things. And especially, I think if like we had a session with Nutkit
Hmm.
also, like the session before the last.
Hmm.
So even there, we discussed that things should work in synergy, like a holistic
Yes,
practitioner should work in
with
synergy
the
with the
vet.
vet. It's not
Huh,
like only I know
huh,
best or only I know
huh.
best.
And this
That's how you
bashing
can,
needs to stop. Like,
yeah.
vets bashing the nutritionists, nutritionists bashing
This is
vets.
crazy. I mean, people who should be working together,
Yeah,
the two professions that badly need to be working together. Same like in human
yeah,
health also. Like, how do
exactly.
we treat like a dietitian? ऐसे करके we just
Ah,
disregard them and we just listen to only what doctors are
yeah,
saying for something that somebody else has studied a whole
exactly.
course for.
Yeah,
So
that's true.
you touched a nerve. You know
I
we are
got
going to
it.
take it up.
It's okay.
So next will be what are common signs that a dog might be in pain or unwell, especially for active dogs who hide discomfort.
So it's very difficult to pick up on signs of pain.
Hmm.
Very subtle changes will what you notice first. So maybe like, if it's like arthritis that is setting in, the very first sign that you'll see is that, they will have difficulty getting up in the
Hmm.
morning. So after that, once they're up, they will be up and about, like they'll be running, they'll be jumping, they'll do everything. But morning, you'll start to notice that when you call them after a long sleep, or they've rested for about say an hour or so, and then you call them and for the food or whatever, and they take those extra 5 seconds to kind of just get up and get into position and
Hmm.
come to you. That is a very early sign that there's
Like the way
pain
they get
nearby.
up, is
The
it?
way they get up,
Hmm.
and it's just that they're taking extra time to kind of get into that position.
Hmm.
Because, like, if you've gone on a trek or something, and like after a long time you've gone on trek, and the next day you have these really sore muscles, and you sleep and then you wake up, and that's when the pain is the most. Once you get
Yeah.
up and you get a shower done, you're able to go about your day. That's exactly what is happening with pets
Hmm.
also. That is one very important sign. The second thing would be if they're getting a little cranky, if they're doing their business normally, but suddenly when you're touching them in one particular area, they're like, "Oh, please."
Hmm.
They turn around and be like, "Oh,
Snapping in,
I will
yeah.
snap you." Yeah, they pets don't get cranky without any
True.
reason. Either there's some change in the environment or there's some change in the body, and that's when they'll be doing it. That is another one. Or even in their walks and stuff. So say somebody who's going for 45 minutes to 1 hour long walks suddenly wants to, like, after like say 30 minutes, 40 minutes also, they just like, "Oh, I don't want to," or they start to pant after 40 minutes, and but still they push themselves for the next 15 minutes or so. So those are subtle changes that you will start to
Hmm.
notice. This exercise intolerance is also a sign of underlying cardiac issue. Okay,
Oh.
that yeah, after a walk, they're now not able to take their usual walks. That is a sign of cardiac issue. So then you need to get them checked. Otherwise, illness is also how I would say would be to check their poop. Poop can give you a lot of
Oh.
information. Yeah.
I think all
So
pet parents have a full gallery filled with
yes,
poop pictures that we share with each other. So
that's
that's
the
so
best thing.
important.
Yeah. So if there's
Noticing the
any
poop.
deficiency,
Yeah.
yes, notice their poop. This is not related to bones and joints and all, but that your poop, the poop can give you a lot of information about the liver, the gut, the entire gastrointestinal system. So the texture of the poop, is it bulky? Is it too loose, too soft,
Hmm.
or too glossy, yellow in color? All of these are signs that there's something going on the inside.
Hmm.
Like they could be eating extremely well, they could be doing everything
True.
else normally, but if the poop is not doing properly, then that there means that there's absolutely something
And
wrong.
Doc, I have seen that they show it very quickly. Like even if
Yes.
one meal they're not okay with, it will instantly show on the in the
Yes.
very next poop.
Yeah.
So this is
So
something that we can very easily make out, like that something is wrong because
yeah,
instantly it shows.
it
Even
does.
if
It
there is
does.
no symptom, the poop instantly
It
changes.
does. It does. So that was a very good indicator of something going wrong in your pup's, like dog's body. I think Fifi's mom didn't enjoy that.
She's enjoying so much poop in Himachal for I don't know
Ah,
how many disorders. She can very well join the session and tell us कि oh that dog did
oh,
ऐसा
that.
poop था वैसा poop था and tell us. Okay, so yeah, these are very nice like
Yes.
markers to notice about pain or unwell dogs. So for dogs that love hiking, swimming, camping, etc., how do we protect their joints and prevent injuries as they age?
So this is also very important because we don't want to be putting too much strain on them. One is always maintain them on a good weight. The
Hmm.
body weight, just maintaining their body weight will add a couple of years to your dog's
True.
age. Okay, so maintaining an ideal weight, that means that there'll not be major joint issues, major bone issues, and all of that. Second thing is, if you know it's a say like a 6-year-old dog still wants to go on hikes and stuff, I would say
Hmm.
just start them off on a joint supplement
Hmm.
or like a good joint supplement because with age also what happens, there's wear and tear that is happening in the joint, right? Like
True, yeah.
when two bones are rubbing
Especially
against
with
each other. So the
like
cells,
outdoorsy dogs, right?
yes, yes. So the cells that are producing the joint fluid and all of that will reduce with age. So we're just supplementing that. No need for calcium here because calcium is for bone. Joint supplements are for joint. So this is a
True.
common misconception. People usually say, "Oh, my dog is still on calcium." Like 3 or 4-year-old dogs still on calcium, no use. If you're giving a
And I
balanced
think
diet,
excess of calcium is also bad, like
yes,
that calcification happens
yeah.
and
So that is another major reason. Like recent research papers have shown that hip dysplasia in large breed dogs can happen if they're unnecessarily provided with calcium
my God.
because the bone grows at a faster
Yeah,
rate and because the joint is developing at its rate and the bone is just like,
true.
oh, I'm going to be big now. So that is another thing. So always, if you're providing a balanced diet, there's no need to add anything else. So one is maintain their body weight, keep them on good joint supplements, and understand what your dog is trying to tell you.
Hmm.
Like if they're able to do like a 1 hour trek, but over say in 1 year they're not able to, please don't push them.
Yeah.
They're not us, right? They're not like they don't strength train and do things.
I
So
think
if your dog
safe
is
to
not able,
say what Fifi and I discussed in the last
huh,
session also, that we have to match their pace rather
yes,
than
they
them
can't.
matching ours. Like
They
it's
shouldn't.
useless, it's pointless because they are supposed to enjoy at their pace.
Exactly.
We are supposed to enjoy at our pace because I've seen people going crazy ki nahi, the dog is very sedentary usually, but only one
Huh.
weekend चलो अब हम 5 किलोमीटर
Exactly.
hike कर देंगे. So that doesn't make sense. It will be only discomfort, bring
Hmm.
discomfort for the dog.
I've had people whose dog, it was another beagle, who had a very bad cardiac issue. She was just, I think, 3 years old. And we finally were able to get her under control. And I realized that, she comes back with another episode of cardiac issue because they decided to take her to Wayanad trekking. And I'm like, guys,
My
because you wanted to go on a trek, you
God.
took your dog also on a trek, who's a cardiac patient, who's also obese, which is like she's not a human. Like she doesn't have to do everything that you do. That's not enjoyment
I
for her.
think being an animal is a big disadvantage for them in human
Yeah,
world. Sometimes I feel because they poor things they have to like because we
we
are
are
traveling is
doing.
different.
Huh.
They are just sitting in a car
Yeah,
and just enjoying. But trekking
trekking
and
and stuff.
hiking,
Huh.
it needs to be
Very
done in
bad.
control, especially taking your dog into
Yeah.
consideration. Because
So
as you said, right, that if a dog is obese, that doesn't
huh,
mean that they need to do like a
exactly.
one
Not
2 kilometer
like
trek.
huh, 6 months में एक बार you decided, oh, my dog is going to exercise today. Like 3 hours trek, you do it. And the
True,
poor
true.
thing is also climb, no, because she can't get stranded on the
Exactly.
mountains there.
She
She
will
has to,
follow the pack and
yeah.
she will definitely go.
Poor thing, but we need to understand what needs to be, what's the best thing. So always also talk to your vet. Like I had no clue that they were doing it. If
My
I had known it, I would have
God.
definitely told them, please don't do this. Right? So talk to your vet. Have that open channel to communicate
True.
always. So this, whether it's this issue, any other issue,
Hmm.
we are always open to discussing. So basically, with regards to hiking and all of that, ideal body weight, make sure that they're not cardiac patients or anything, joint supplements, and understanding your pet basically. That is one thing. So if you feel like no, it's becoming too much, then stop. That's all.
So one thing more I want to add on to this doc, like we have seen a lot of those red light therapy devices that people are
This, huh?
using. So
Yeah.
what I know is that when the dog is in pain,
Hmm.
they really help, and people. But I have seen some people advising and some pet parents doing it, like in generally also like that infrared
Huh.
light is there, and that if because I don't know if my dog is in pain, so I'm just
Yeah.
using it to. So is that required, or does
It's
it have any harmful
not.
effects, or it's like okay?
See, anything in excess is bad. Okay, so IR is also something that's going to increase the infrared light is basically like laser, similar to so light is kind of coming, it's kind interacting with the tissue cells and it's increasing the circulation there, increasing the lymphatic drainage, and that's how it's also helping release some endorphins and anti-inflammatory
Mm.
substances. But if you don't think there is anything, then what are you increasing the blood circulation to? That
Mm.
becomes useless, and that is not something that I would be recommending. And also the duration, like people just see it on, somebody else is doing, or my doctor told me to do it, so I will do it on my dog. Like, would you do it on your child? You
True.
would never do that, right?
Yeah.
If you had a 1-year-old toddler, you would never say things like, "Oh, my doctor told me this when I was,
Experimenting on
yeah,
them. Yeah.
yeah." You would never do that. But why are you doing it on your dog? If there is no symptom, then don't act per symptom. Like, they will try to do IR, they will try to do other stuff at home, acupuncture, they'll only try, but they will still not do medication. And that's like the
True.
stupidest thing. Yeah, what is needed? See, and another thing that we need to remember is laser, IR, all of these are just adjunctive therapies. They're not the sole therapies.
True.
They need to work with the medication to reduce the dosage of the medication. If there's no medicine at all, this is not working. Okay, it's basically like
True.
that.
Yes, I mean, if you know your dog is in pain, then speak to
Yeah,
the vet and do it. But
some,
if they're not in pain, just assuming that they
no.
might be in pain, these things are not
Yeah, not
necessary.
necessarily. Like even laser, beyond a particular time, we're not supposed to expose them to
Hmm.
laser, right? Because it starts to destroy the
True.
tissue there. So
Yeah.
if you're not keeping it at the right distance, if you're not keeping it for the right amount of time, then you're just harming your dog. Why would you do that?
So yeah, I think excess of
Yes.
preventative care is also very bad.
Yeah.
So the next question is, are there specific warm-up or cool-down exercises for dogs after intense physical activity?
Hmm. So warm up is something I would say, like just starting off with leash walk. If it's some hyper dog, then definitely please start off like that, because don't just take them to the park and just let them
Hmm.
loose and run. They will definitely strain themselves. Small, maybe short, like a 10-15 minute leash walk where they're controlled in their area, that would help.
Hmm.
And post that, as a warm up exercise, you can still, again, just play with your dog. Don't just let them loose. So maybe if you have a ball, you can just kind of change sides and make them go in between your legs. Just in that area, may like a tug of war kind of a thing with your dog. That would be helpful as warm up exercises. But cool down again would be just be if you're just finishing it off, don't just stop it. Bring down to them to again walking them. Maybe 10-15 minutes again, just slow walk so they kind of calm down,
True.
their energy levels come down. So
Yeah.
warming up will stimulate them mentally to kind of get into that phase of, oh, I'm going to now be active. So I'm warming my body up. They need
Hmm.
to also understand cooling down is also important. Stretches are something that you can do. I don't know if parents will be able to do it
Yeah,
properly. There are a lot of
and not all
you
dogs are
could
comfortable with that.
yeah,
Yeah.
exactly. So stretches, like once you come back home, if your dog is comfortable with that, just kind of very gently flex and extend their joints. See if you need to massage the areas. I think that we also have one video put up on our page also. So like how you would like how to cup the limb, how to kind of how much pressure to apply,
Oh,
when
that's
to
nice.
stop. Yeah, when to stop, because that is more important. If your dog is resistant and you're just pushing for massage, it's not
Hmm.
helping. Okay, so
True.
things like that. But it's keep it simple. Let's not make it too complicated. Also, don't just let them loose. That is also important.
True.
Yeah.
So that's I think I can share this reel that you're talking about, or the post after our
Yes. Yes.
live, because that's very important. Even I don't know
Yes.
about that.
Yes.
So people should know
Ha.
like how to calm their dogs down and give
Yes.
them
And
some rest.
massaging
Massaging,
and
yeah.
flexion extension, like they need to know when to stop, when to
Hmm.
do it
Hmm.
properly, and the right way to do it. All of that is very
True.
important.
Yeah, otherwise
So
accidentally we can hurt them.
yes.
So, how important is tick and flea prevention medication? Why do we have so much debate around them? What is
Uh,
your insight on this whole subject? Bravecto, as we know, is banned in many countries. Then, is it still safe to give it to our dogs in India?
So
Here
tick and fleas, there's no
comes
debate
the
at all.
controversy.
Yeah. I'm sorry, but I will stick to being a vet here. There's no two ways about tick flea preventatives. you don't want to do Bravecto. See, I have not seen a single dog have a very bad reactions to Bravecto. I know pets who've had like bad gut for the next couple of days. That's I think the max that we've seen. Liver issues. See, dogs with liver issues, dogs with neurological issues, we absolutely prevent using any of these oral medication. So no, in those cases, yes. Also, this banned Bravecto, I don't think it's like banned. There are petitions that have been applied and like proposed, but I
Hmm.
don't think it is banned. Even today, for the sake of the live I was going through, and I don't think it's actually banned anywhere. And the debate around this is actually very stupid
Yeah.
because see, I have seen such bad cases of tick fever that it's just very sad to see your pet in that state because you decided you wanted to do something that was
True.
holistic or natural because it doesn't work. If it did work, then it would have worked always. And so Bravecto, I'm not somebody who's against Bravecto, but if you want other options, I am somebody who was very open to giving you other options. There are other options like, see, Bravecto works for 3 to 6 months basically. So that means there's a high dose of the medication
True.
in that one tablet.
Hmm.
That's why it is working for so long. There are other options like Simparica. There is also there's
Next
another
guard.
next guard.
Hmm.
Yes. So these are simpler versions of a similar drug, less concentrated, work for about 1 month to 45 days. At least keep them on that. If you still don't want to do oral medication, don't no oral medication at all, do at least a spot on. Okay. I really need to mention this. There was this one person who on with a lot of followers who said that, they're against spot ons because when you wash the dog, it runs down into the water and then it's harming water bodies. So I want to tell you that this is very, very stupid because first of all, you don't know how a spot on works. If you're saying
Exactly.
things
It's
like this, you
not a
don't know how a
shampoo.
yes. So please, like people need to stop believing in this. Like you sit with a kilo of makeup on your face and you say things like, spot on is going to ruin water bodies. I'm sorry, I will not agree with you there.
True.
At least a spot on. Like, once a month, just do a spot
Yeah.
on. Because
So
ticks
I
and fleas work.
have no shame in admitting Penny is on spot on.
Huh.
Apart from all the diet and working on there
Yes.
is only a limit to working on immunity and working on diet.
Yes,
So
exactly.
apart from that and putting garlic and because the infestation, I mean, I am so scared seeing the amount of cases that are coming
Yes.
up of
It's
fever these
scary.
days. Every second, third dog I
Yes.
know is contracting and then relapsing. So it's like better safe than sorry, and it's
Yeah.
always best to educate
Yeah.
yourself and do your research and don't just sit high on your ego that no, this is what I believe till this
Yeah.
date. How can I undo that? I think that's most important that you
Exactly.
need to change.
So that's what. So if there is a safe option, like see, spot on might not work in very severe infestation. If there are like 20 ticks on your pet's body, for that immediate action, you spot on might not
Yeah.
work. So one dose you might have to do. Or if you still want to not do it, then maybe you can do like a medicated bath with a tick spray, regular brushing. That is something that you can still try, but I would not want you to be risking it because see, all of these are very short-lived. Okay, sprays and baths are all very short-lived. And so the basis, but like how tick fever spreads is basically a tick latches onto your pet, stays for about 12 to 24 hours, and that's how the organism is transmitted.
Hmm.
The good thing about the oral medication and spot-ons are that once the tick bites, when the pet is protected, the tick will fall off and die. So there's no time for them to latch on and stay on the pet to transmit the organism. That
Hmm.
is the basis. If you're doing anything else, it's not working. And
True.
you are risking your pet's this thing. So, and like I mentioned, like I am not against anything. But if you want to have a discussion, and it's not about just ticks, right? Fleas also. Even fleas are a big menace. We usually tend to think that ticks are the major cause, but fleas tend to like see again they're resistant to most natural things,
Absolutely.
and
Absolutely.
fleas,
I
yeah,
think even ticks have evolved. Nothing
yeah,
seems to work. I remember that, there was so much talk about ACV
yeah,
solution.
yeah,
That is not
exactly.
working. I think even garlic in food is not working
It's
because
not.
they have evolved like crazy and
Yeah,
it's like nothing is working except, just that one
the
sure
chemicals.
solution that's always
Yeah.
been there.
See, if a mosquito is biting you, wouldn't you use a mosquito repellent? Wouldn't you put Odomos on yourself?
Yeah.
Why are you so against? Like, बस कुत्ते के लिए क्यों natural करना है? Then you
Yeah.
also apply turmeric or whatever ACV on you and sit now. Then no, you won't do it. It's
Yeah.
all just for the show. And fleas are what I was trying to say is fleas are not just skin issues. They also transmit worms into the dog's bodies.
Oh
I
God.
remember I'm bringing this up because there was this one client who would in a 3 year span, the dog, her gallery was filled with dog poops. Like she had every Deka poop and not one normal poop for 3 years.
My God.
Why? Because she decided to go the natural way. Her dog has worms. Okay, every vet that she's consulted with has told her your dog has worms, but she's still not ready to accept it. She knows there are worms, but she's like, can I do something natural about it? Like she's so brainwashed that she wants to do natural things. She is putting her dog at risk. So the quality of your dog's life is extremely bad. I'm sorry. Okay, and so even when we were trying, so she's consulted like a pet communicator who's told there's some issue in her, there's pain in her abdominal area. I'm like, madam, that is worms.
Oh
She's seeing worms
God.
coming out of it. She'll do one dose and then she'll be like, oh, one dose is enough. That's too much of toxins. So please don't be afraid. Like, just deworming your dog is not going to kill your dog.
To be
Okay, there are
And I
worse things.
think it also depends on dog to dog. Like some dogs, like
Yes.
mainly are Indies, they are blessed with
Yeah,
good
yeah.
immunities. So maybe you can go easy on things
On
with
them.
them
Yeah.
about medication and maybe even,
Yes.
other natural ways. But, for pedigree dogs, I've seen, even in
No.
them, there are dogs who have very good immunity because they are
Yeah.
fed very nice food since the puppyhood
Yes,
age.
yes.
But it cannot work like that's not a one
It's
shoe
not the
fits
soul.
all,
Yes, yes,
that
yes.
every dog can thrive on one particular way. So I think
Yeah.
maybe because natural doesn't harm, so you can
Doesn't
do
harm.
that
Yeah. But if it's
while
not
also
working.
considering, because I've seen people who live in very densely like vegetation areas, and
Hmm.
even they say that I'm not going to apply a spot on. I mean, come on, you're
Yeah.
living in the heart of ticks and
Yeah.
fleas. Either
And
you're
also,
very particular about it ki nahi, I do all measures, every day I'm fumigating, but that again
yeah.
has its own harms.
Yeah, because
So
they see ticks and fleas can live in cracks and crevices. They live on the bedding. So
yeah.
every time there's a tick infested place, if people ask, we tell them to get a pest control also done. Because
Hmm.
it's impossible that you can get every single tick out of your house. It's not
True,
possible.
yeah.
And also, when we are now, especially in Bangalore, the pet parent community is so big, and we're all coming together. Like we have events going on. Like we had PetFed recently. So when you're exposing your dog to so many other dogs,
True.
there's no way that your protected dog with natural remedies is protected, like safe now because other
Hmm.
dogs are not protected. If everybody is thinking, oh, my dogs are natural, then all of your dogs are going to get
True,
infested.
yeah.
And yeah,
That
yes,
it
so
takes just that one tick
yes.
to just.
One tick. That's what I always tell people. See, if but they'll be like, the dog was just one tick, but that's enough. If that one tick had the organism to spread tick fever, then that's enough. Because it's basically like, me and you sitting in the same room, 10 mosquitoes bite me, one mosquito bites you, but that mosquito had the dengue virus, then you will get dengue.
True.
I will not. So
True.
it's as simple as that. So this fear needs to go. It will take time because social media pe also there's so much
Oh my God.
bashing of
If
everything, like
only
basically.
people are getting more
Yeah.
and more scared
Yeah.
because of so many, practitioners and, people coming and scaring them. Even I was
Yeah.
scared. Like, I have not given any take medication to
Huh.
Penny till date. And very, very, I will admit, like, it took me a lot of,
Courage.
convincing and reading
Yes.
and discussions to start her on spot-ons.
Yeah.
And I have seen an amazing result because thankfully she's on good food since the very
Huh.
beginning. So that has helped. Some genetic factors are also there, but
Yes.
it's good for her. But I cannot do without a spot on, considering like
Shouldn't.
our society is very green. So
Huh.
plus there are so many dogs. We go to the lake, we
Yeah.
interact with community dogs. It's impossible to rule out the external factors.
Yes. And I'll tell you one more thing, like a simple thing. See, I have nothing to gain out of you buying a Spot On or a Bravecto anywhere. Like you sit in, I've not even met you. So you could buy Bravecto anywhere.
Hmm.
So I am not getting anything into my pockets. But usually these people that are bashing Spot Ons and Bravecto, like against Spot Ons and Bravectos and saying all natural dewormers, all natural tick flea controls, they will be promoting their product. At the end of the reel, you will definitely see that there is that one product that they want you to buy. Please don't fall for that. See, pet industry is blooming in India, and it is blooming at a scary rate that everybody wants to do something in this space. Like they want to
True.
establish themselves in this space.
And it's
So if you
unregulated.
yeah, it's
Biggest.
unregulated in India. Who's doing research? See, researches have been done on spot-ons, on Bravecto, on NextGuard, Simparica, all of these, and that's the reason you're able to pick up one article and be like, oh, this is bad for your dog. Who is regulating your dewormer? Who is regulating your probiotics? Nobody.
And
Like, there's absolutely zero research.
I would also say I'm very, like, I feel very furious on this attitude that, sterilizing community dogs or vaccinating community dogs or, putting them on tick medication is absolutely fine. But when it
Huh.
comes to your dog, you will be like, no, it's bad, this, that. So if you're putting it on that dog and that dog is thriving literally,
Yeah.
a vaccinated, sterilized, and, health-wise tick flea prevented dog is the happiest dog that I've seen, like the
Yes.
healthy. So why cannot you take that into consideration for your own dog?
Yeah.
So this is one narrative that I have thought a lot about, that all these people will always be
Huh.
very, no, we should sterilize community dogs, we should vaccinate
Because you don't
them.
want
And
stray dogs. You only want
yeah,
your
and
dogs.
we should give them tick medication and all that. But when it comes to your own dog, achanak se your knowledge on dogs changes entirely,
Yeah.
and you are like, no, for our dogs it's
That's
different. So that doesn't
just
make
double
sense. This is so
standards.
confusing,
So much
and this actually
double standards.
confuses more pet parents.
Yeah. So that's what I think we need to set up a channel. Like I was saying, we need to set up a channel where they're able to talk to their vets openly.
True.
Like, see, when somebody comes to me and says, I don't want to do this, I'm not going to be like, oh, you're so stupid. Like, how can you say things
True.
like that?
Yeah.
No, let's sit down, let's have a discussion. We'll come to, like, see, at the end of the day, it's not about what you want, what I want. It's what the pet is needing.
True.
Okay, for me, it is that. For you also, I know, Dave, but then that is what you
Yeah.
want. You want the best for your pet, and we just need to have that discussion. That's
And
all.
that
Yes.
open-mindedness to,
Yeah.
change your thought, school of thought, and take updated information and then
Yes.
change your decisions.
I
That is
have
what is important.
I have had to share articles about neutering age, to parents because like once there was this Labrador's dad who wanted to neuter him at 9 months of age, and I was like, no, that's not the latest updated, regulations and all of that. Like, no, like I've had dogs all my life, and we used to do it and all. So, but at least at the end of it, after I shared the articles and I said this is the gist of it and all of that, he was convinced. And I am happy that I was able to change one person's mind, right?
True,
So
yeah.
let's have a discussion. Like, if you're open to reading research articles, I will share millions of articles with you. Like, please ask us. We're not saying that, we don't want, like, I'm saying this is the end of it. At least the new age vets are not like that.
True.
So please try to have a discussion with your vet.
That is very important. And
Yes.
understanding, like, we are always on the verge of bashing them that
Yes.
they, unnecessary medication, this, that. But
Huh.
when it comes to sitting down with them and understanding their point of view, what they're trying to say,
Yeah.
that is also very important because we do not know about that, and there is
Yeah.
nobody talking about all that stuff. So yeah,
Yes.
thank you so much. This was such a great insight, and I think we've covered a lot of questions
Yes.
in this particular segment. So okay, the next is how do we protect dogs from outdoor risks like ticks, waterborne illnesses, or hot surfaces during adventures?
So ticks, I think we've already covered.
Yeah.
So despite being on tick prevention, like I mentioned, they can still latch onto the pet for some time. So one, I don't know if this will work on everybody, but with one pet, what I noticed was that they were going to Chikmagalur or something, and that was infested with ticks. He was already on NextGuard, and we chose to see how diluted Savlon would work, and it worked very well. Like so, every time before they would take him out on a walk, they would spray his paws, tail, and this area with some diluted Savlon. I think the smell is kind of what
True,
prevented the tick
repellent.
from. Yes.
True, but
Uh,
wouldn't it harm, like, if the dog accidentally licks it?
No, diluted Savlon is okay. It's
Okay.
basically just chlorhexidine, so that's not a problem at all. So
Okay.
diluted Savlon, and it's at the back of his paws and all. And by the time he goes out, it's all going to be dry. Just the smell is going to stay. Might
Okay.
stain a little bit, but absolutely, we've been using chlorhexidine Like chlorhexidine is in all of your like even mouthwashes and all of that. It's
Mm.
absolutely safe. No problem with chlorhexidine.
Mm.
But betadine, if it's undiluted, would be a little irritating. And even like Savlon, basically, if it's not diluted, then yes, it will cause some
So what should be
gastritis.
the dilution ratio like?
So we say make it light orange, very light orange. Ideally 1 in 4, but sometimes I know that people can get a little confused. So I show them a bottle. This is the lightest orange that you can make. That's all.
That's a very nice tip.
Yes. So that
Yeah.
is something that has worked for one dog. I don't think I've used in many others, but that worked very well. Like the parent was also very
So
happy that none of the ticks
that
got
just
out of him.
did not have
Yes,
more,
I think the
like
smell.
more ticks didn't latch
Yes,
on.
yes. Basically, that's what happened. That is one thing. So keep them on tick preventative. Make sure of this. And also, once they come back, please have a thorough check. Okay, face area, behind the ears, paws, these areas, and axilla. Okay, those areas, they'll just crawl and just sit there. So check those areas properly. This will usually be able to solve tick problem.
Mm.
When you go to water bodies, there's unfortunately no way to control what your pet, the amount of pet
Yeah.
water that your pet is drinking or anything. So make sure you have a probiotic, prebiotic supplement handy in case they have a bad gut. If it's the beach, then please make sure that they're not drinking excess water, because we do have cases of salt toxicity that happens,
Mm.
and sometimes it goes into their lungs. So that you'll need to be a little careful. Maybe don't let them play too much, and if you feel like they're drinking the water and all, please stop them from doing that. What was the last part? There was something else also, I think.
Um,
Hot
hot
bathing.
surfaces, yeah.
Hot surfaces, ideally don't walk them on hot surfaces at all, because it gets like their paw pads, they look very sturdy, but they can get injured very easily.
True.
So if you can do it only in the summers are getting really hot here in Bangalore also, right? So do it early in the morning, late in the evening. Hard surfaces that easily give off heat, like so those surfaces prefer to do it there. But if you absolutely have to take them out for a pee, poop, or whatever, then maybe put on some socks or like a boot on them. So get them used to doing this,
Mm.
ideally. And then take them out quickly, bring them back. Ideally, I would never want you to keep your pet outdoors at all when it's hot.
True, yeah.
Yeah.
Yeah, I think managing timings is the best we can do in
Yes,
that
manage
case.
the timing.
Okay, what precautions should we take during extreme weather conditions like heat waves, cold snaps, or high altitudes?
So heat waves, again, please make sure they stay indoors. And even unfortunately, 2 days, like we had pet fed, right? There were so many dogs who were panting and they'd stayed from start till end. It's not needed. Your dog is not asking for it. I know you've paid for it, but unfortunately, that's not the best thing for your dog. So on hot days, please don't expose your dogs outside, because
With
this will.
clothes on, that's the
Yeah,
worst.
and they had huskies, and I was like, oh my God, that is really
Wow.
sad, because that is not natural for them. You want to do something natural, please keep them cool indoors, give them enough mental stimulation, physical stimulation indoors. Don't bring them out in the hot sun. And even if you have to bring on, like I said, make sure that it's a quick walk, take them back. But in the morning and in the night, take them for a very good walk. So exhaust them at that point. Let them get their stimulation at that point.
Mm.
But say in case you've had to take your pet out and now there's like an emergency that has happened, like say they've had a heat stroke, then one is obviously you have to take them to the vet. But on the way, passive cooling, like splash a lot of water on them, put a cold towel and keep changing the wet towel on top of them. Give them enough space to breathe. Okay, and give them laps. If they want to take some laps of water, let them take. And then hot weather. So this is for like emergencies. But otherwise, if it's too hot and you feel like your dog is getting too dehydrated, keep ice cubes in their water. Or in some of them will be very fussy, so you can also freeze broth and give them
Mm.
those cubes to them. You can also give chews, like freezing a carrot and giving it to them, adding little extra broth or little extra water content to their
Food,
homemade
yeah,
food.
yeah.
Yes, so that is how you will be encouraging them to drink more water. Otherwise, they will definitely go into heat. And keep them in a cool area. Usually, don't let them in the balcony, especially if there's direct sunlight during the day. Early morning, evening, let them enjoy their view. But post that, I would ideally suggest, because especially if you are working or you're out of the house and they get exposed to it, but they don't understand all this, right? They might just stay there, and then by the time they want to get up and come, if it's already too late, that becomes an emergency. So
True.
harsh conditions, hot conditions, these are things that you should be aware of. Colds are not extremely cold here, but like early in the mornings are a little too cold. I think that's when we'll be taking our pets for walks. So boots are something that I would suggest. If they're like a double coated dog, then it's okay to take them out without any protective like clothing and all. But if it's raining, please put on like a raincoat that you have with the hat and all of that. They look extremely cute too.
Yeah.
But it's a small, like an indie dog and all. Please put on something so they don't start shivering. And they will give you signs, like if they're sleeping in a warmer place. Usually, I have people who say, usually he would sleep on the floor, but now he is preferring to come onto the bed. Please let him sleep on the bed or give him a separate bed. Keep him warm. Keep a blanket around him. Do things like that. But otherwise, it should not be a major problem. Cold is not a major problem here. But if you're living somewhere in a very, like, Himachal and the snowfall and all of that, please be aware of frostbite. So don't take them out in the snow and all
Would
without any
dogs also
protection.
have
Yeah,
frostbites?
yeah, yeah,
Oh
yeah,
my
they
God.
also, they
I see.
also.
I didn't know this. I'm so glad
They
we
do,
are
they do.
discussing this.
So please don't take them out. Like if you wouldn't go out, don't take them out. So try to do their business
And I
within.
think it
But in that
depends
case,
upon the breed also. Like,
yes,
I
breed.
think if you have a husky,
Yeah.
then they
Yeah,
love
and
to play in
these
snow. So,
Gunny breeds and all in the north, like Himachal, and all, they're very sturdy. They live their
yeah.
lives there, so we can't.
Yeah.
Yeah, so that is their enjoyment. Let them do that. But if it's like you're taking a bulldog from here to that place and then expecting him to get adjusted to it, it's not going to happen. Let it also be slow. If you're going on trips like how Fifi usually goes, which I've not been able to. So in those cases, go a little early. Don't go during the extreme condition because it will be like a shock to the body.
Hmm.
Uh, let them get accustomed. Maybe do like a trip or two before you go, and
Hmm.
then they will be able to adjust. So that is one thing. Higher altitudes, avoid flat-faced breeds from taking to high altitudes because they will usually turn into
So,
like their
can
oxygenation and
you
all of
like
that.
just give an example of
Like
that? Because
a
most
pug, a
people
Shih
must not be
Tzu,
knowing.
sorry, a pug, a Shih Tzu, like a bulldog, pit bull, all of these are flat-faced. So I would
Boxer, I would
especially
say, right?
boxers. Boxers are though, although they're slightly better, like they're deep-chested, so they're able to take rigorous activity slightly better. But pugs especially, please avoid taking them to like all of these high altitudes, too cold. I wouldn't want that. Even actually hot climates. Like I've seen pugs also with heat strokes. So try to be very mindful because they're very tiny. So we need to understand that there's very little that their
And
hearts and
this
lungs can do.
like
The
stub nose
fat,
comes
yes.
with a disadvantage
Yes.
in that
So if you've
aspect.
not had a corrective surgery of the nostril, of the soft palate, then the chances of because the way they breathe itself is very limited, already limited. So the amount of oxygen that they'll be getting is very less. So high altitudes, may usually the conditions that you see would be that getting restlessness, breathless, and all of that. If you notice any of these symptoms, immediately come down. Like if you're on a hike or something, or if you're traveling and you see that your dog is breathing heavy, make sure first of all that the temperature within the car or whatever is ideal. But if that's not the case, if temperature is not the problem, take a break, come down, let the dog settle down, get an X-ray done because we don't know what's happening on the inside. But ideally, before going on a trip itself, have a check done and make sure your dog's heart condition is good. So after that you should be
Especially
able
like if
to.
you're going in higher altitudes,
Yes,
right?
yes. Higher altitudes, absolutely. Because without a good heart, it's absolutely pointless that you take your
So,
dog on.
like coming on that point, is it like the level of endurance that we have for altitudes, and like how humans start feeling a little breathless and
Yes,
we
yes.
need oxygen on high altitudes. So, is it the
See,
same for dogs, or they have a higher endurance
no, no,
maybe?
no. So it is similar. It differs again from dog
Hmm.
to dog. You'll not be able to understand how sturdy your dog is without exposing them.
True.
But symptoms are very similar. Like they will be short of breath. They will start showing symptoms of, not being able to breathe, kind of just going down. They don't want to move at all, things like that. We would want to immediately address it and if you have like handy oxygen or something,
Hmm.
best. But I don't
Because
think
I
that's the
remember
case.
like Murphy, he went to Leh
Hmm.
Ladakh like a month or two
Hmm.
back, and there, you know, his like his mom had to take
Hmm.
oxygen
Hmm.
for a bit, but he was completely fine. So
Okay.
that's what I was wondering that, like as you said, it depends from
It
dog to dog, and
depends from dog to
especially
dog.
with the stubbed
Yeah,
nose dogs,
yeah.
it will be more
It's
difficult,
very
I feel.
difficult.
Yeah.
Like the long-nosed ones are
Hmm.
usually
Hmm.
okay. But heart is something that I cannot comment on because
True.
even
True.
golden retrievers are predisposed to heart
Hmm.
conditions. So that is something that we don't want to, like,
So
I
I
don't want to
think,
risk it, that's all.
like as we have already discussed, getting a thorough check, that's
Yes,
what
yes.
something we always follow. Whenever we're going on trips or any, even a short trip, we just take a casual,
Yeah, yeah.
visit to the vet and we do it. And especially like our upcoming long trips, so definitely we get an extensive checkup
Hmm.
done because you don't want any
Yes, you
surprises
don't.
in places where nothing can be done.
Yeah, you
Especially,
absolutely
like
don't.
you said, in high altitude, so you should definitely get
Yeah,
things
like
checked
वहाँ पे
very
एक तो
thoroughly.
like vet care is also very limited. I think Fifi
Yeah,
also the first time or something. I think when she was a smaller girl, when they'd gone, she had some
yeah.
issues. I don't know if it's Fifi or I think it is Fifi. So like you start to panic at that point, right? Like you don't want to be in that situation. So
Hmm.
ideally, don't put yourself in that situation. So
True.
always have a thorough check, especially the heart.
Hmm. True. That was very insightful, seriously. I mean, this session so is like SSL bringing these
Eye-opening.
moments for me. So, okay, then the next question is how to rule out symptoms for possible illnesses in community dogs.
So usually they're a little more sturdy. So I would say when we talk about indie dogs, I would not say indie dogs at home are as resistant to infections or weather conditions and other stuff as the stray dogs. So inside the home, usually what happens is they're very nervous. The adopted ones usually are nervous, so they do have different set of issues that we need to address. But stray dogs, may what we can look for is usually the same signs. Like if you are somebody who's feeding them regularly, notice if they're coming for the feeding or not. Generally, you will not be able to see their poop and pee. So
True.
poop, pee, all of that is not.
If you're
So,
lucky,
but when
you
you meet them,
might, but otherwise,
yeah,
yeah.
they might throw up in front of you or poop in front of you, but usually does not happen. So look for signs of hydration. So that means like if they're coming to eat their meal, are they finishing what they're used to finish?
Hmm.
Are they staying away from the pack? So they would want to isolate if they're feeling a little sick, and the others also will not want to be with a sick dog. Like there will
Oh,
usually be a
oh,
little
yeah. True,
separation
true,
that you
true.
would notice. Like this guy would have gone some other place and he would be there. That is one thing. And hydration is something that you can check. So if you just pinch their skin and if it falls immediately, that's a vague way of checking for hydration. Eyes are too deep, that means that there's a lot of dehydration happening. That is another way. Also, just check their ears. Like that is one way that you can check for temperatures. Okay, so
If
you'll
it's
not be
like
able to,
hotter
yeah,
than
if it's
usual.
too hot to this thing. Any other wounds on the body, stuff like that. Usually, if there's like dribbling of urine, there will be urine scalding happening. If there's like a skin infection, very obviously you'll be able to notice. Or if like there's head tilt to one side, there could be an ear infection, there could be a neurological issue. Very rarely we tend to see that there's like a ear hematoma or anything, wherein like blood accumulates in the ear
Hmm.
flap. But you can notice these symptoms. It's obviously a little difficult, but if you notice that there's smearing of poop around the rectal area, could mean that, or if
True.
it's too red, could mean that he or she has been pooping multiple times or has had loosies, things like that. So those are because it's going to be very vague and you need to know the dog. So you need to know what is normal
Absolutely.
for the dog
True.
to judge what is abnormal. So
Hmm.
unless you are somebody who's been feeding them or has been interacting them very frequently, you will not be able to pick up on these unless it's like, temperature, hydration, or, excessive poop that is stuck
So
around
have
their
you
area.
seen like if some dog community dog contracted tick fever, so what kind of symptoms would they show?
Huh.
Because with our dogs who are constantly under our vigilance, we can
Yes,
notice a
yes.
lot of things. So how do we identify whether this dog probably might have tick fever because they're very prone to
Huh.
ticks and
Yes, yes.
infestations and all.
So we had a community dog who used to live in front of the clinic, and he was picked up. Like somebody complained, and he was picked up by the government, whatever that NGO, whatever thing. And when he came back, we noticed that he was covered in fleas. So we did a
Oh my
spot
God.
on ticks and fleas, and we did a spot on. And because we knew him so well, like he would let us check his mouth and everything, we would immediately, even like a week or so, we were able to understand that he had gone pale. So when you check his gums, check their gums, it'll from that pinkish to looking less pink or even almost white. That is one way. The second thing that we noticed in him was that he was being very aloof. Like even for food, he was a foodie. Like you give him anything, he would devour it.
Hmm.
And he would not come for food. Like he would not, even if you just call him, no, he would be like, I'll come later, and things like that.
Like
He wasn't really
not very
warm. Yeah,
motivated
not
and
very motivated. He wasn't warm. And so something that I need to add about tick fever is that tick fever is actually a very layman term. Tick fever does not always present with a fever.
hmm.
The ideal term is tick-borne illnesses.
Hmm.
We're just using tick fever
Yeah.
as the broader
Lyme
term
disease
here.
and
Yeah,
all
yeah,
that, yeah.
exactly. So he didn't have a fever, but his lymph nodes were enlarged. We got a CBC done on him. So these are also symptoms that
Yeah,
you will
this
be
is
able to see.
another very good
Hmm.
symptom. The lymph nodes get
Yes,
enlarged with any infection in
yes,
the body.
yeah. So
See, I
especially tick
also know
fever.
things.
You must have read.
I faced
So,
it with Penny. That's how,
oh,
with the experiences you get to know if there is an infection.
the
The even like
lymph
humans
nodes.
also, right?
Yes,
The
yes,
lymph
yes.
nodes get swollen.
Yeah, so we did a CBC. We were not able to do a PCR or anything on him, but we just did a smear and we were able to do one dose of imidocarb. So he also started getting, so because everything happened so suddenly, it could be because, he had ticks suddenly from the area, from the place where he was kept for a month. And because he was always on tick prevention, but he came back covered in ticks. And 1 month we had not seen him. So could be that, he contracted the disease at that point. Or second could be because he was so stressed at this place.
Yeah,
That
compromised
is the reason
immunity.
something
Yeah.
that was already there kind of just popped up because post that he started freaking out even if we just because we took his blood, we gave him the injection, and then he started freaking out. He would not come communicate with us. Like even if we left, it took another 3, 4 months for him to get used to us. He was very scared that what if we throw him into that hell again, that kind
Yeah.
of a thing. So
I think
those symptoms.
behavior tells a lot.
Yes,
With
yes,
community dogs, especially,
yes,
this behavior is the biggest,
yes.
marker where we can identify illness.
Yeah. So things like that. So if you're able to, it's a little difficult for a person who's not trained in veterinary or medical field to understand where the lymph nodes are. But once you are able to understand, if you just go to the vet with your dog itself, they'll be able to show you where to look for
True,
the
true,
lymph
true.
nodes.
Yeah.
So those are one thing.
And it
Looking at the
feels
gums.
like, a hard mass, it
Yeah,
feels
yes.
swollen. Yeah.
Yeah, and looking at them if they're pale, that is second indicator that tick fever is definitely there. Like usually that is what makes them
Mm.
pale. So these are symptoms that you can look out for in tick
Very,
fever,
very
but
good and important
home.
information,
Yeah,
because I know
yes,
we have
yes,
so many amazing people who are
yes.
feeding dogs and, are taking care of the community dogs. But these type of information, even they
What to
won't
look
be
for?
having what to look for, how to
Yes.
identify. So it's always like cure with community dogs. Like
Ha,
prevention is not
yeah.
common, and because people don't know how to
What to?
identify. So
Yes.
thank you so much for sharing these. It's so important. Like even I know what to look for now.
Yes.
So how can we recognize early signs of conditions like arthritis, hip dysplasia, or heart disease in active dogs?
So, like, I think we've already covered arthritis,
Yeah,
like getting
most
up,
of it.
slight delay in getting up, and pain, reacting to touching certain areas. These are all signs of pain. Hip dysplasia, again, when it's a puppy and the dog is a puppy itself, we'll be able to see signs like, the way they sway
Walk.
and move. Yeah.
Yeah.
It's very evident. And when they're sitting, I know it looks very funny and we think it's very cute, but just putting one leg out, the back leg may one leg out is a sign of hip dysplasia. So it could mean that that leg he's not able to bear weight on. You'll also see one very important point that I forgot to mention is loss of muscle mass. So say there's more pronounced hip dysplasia in the right joint. What the pet will do is he or she will start to favor the left leg. So the muscle around the thigh of the right leg will start to become thin. It'll atrophy. That is called disuse atrophy. So because you're not using the limb properly, it is looking thinner. So
Hmm.
that is also very evident, especially in muscular dogs, like the big breed dogs. You can very quickly pick up on symptoms like that. So hip dysplasia may, if you compare and see one leg is thicker than the other one, then definitely there is something going on.
There's one
Um,
Just sorry to
Sorry,
interrupt.
sorry.
Just related to that, there's one question that does the sticking one leg out in case of HD also happen with cats?
Yes, yes, it does. Usually, you see it more with obese cats, if
Hmm.
you've noticed. Otherwise, cats will be able to sit properly, jump properly, walk properly. So always get that checked because I have never seen a normal cat sit abnormally. I've seen a lot of dogs and we miss that symptom, but cats usually, yes. I think Suri is us. Yeah.
Yeah.
What was the
Uh,
last part? Hip dysplasia,
and
arthritis,
heart
and then
disease. Heart
heart
disease in
disease
active
again,
dogs.
exercise intolerance. That is one symptom, exercise intolerance. And reverse sneezing is a very common thing. So it's a normal thing for them to happen, like our sneezing, but excessive reverse sneezing, like, continuously they're just sneezing excessively, or excessive snoring in the night. We've seen that when there's a little bit of lung congestion happening because of a possible heart condition, these symptoms also pop up. So always be mindful of what, like, so you need to know what is normal for your dog. That's when you'll be able to identify what is abnormal. Okay, so
So do
reverse
these
sneezing is,
things like appear in the blood panel that we do? Like suppose if a dog is
huh,
having some, beginning to start having
hmm,
some heart issues. So is it only detectable by an echocardio or maybe a
yeah.
normal checkup, or we can detect something in the blood reports as well?
So blood reports में you can check something called proBNP. That's a marker.
Hmm.
So if there's an early change in the heart, that's the reason we mentioned that, post 6 years, ideal to just get that
Hmm.
once a year. So proBNP is something that you should be checking. That you can check in the this thing. See, like I was saying, some conditions I can pick up on a auscultation. Like when I'm listening to their heart, I'll be able to pick up on a murmur. But if it's like simple dilation, I might not be. So that's when we would be like, we have symptoms, but we don't have a clinical sign that I can pick up on. Then I will take an X-ray. On the X-ray, if I find something, definitely an echocardiography
Hmm.
and an ECG. So it's a step-by-step thing. I will not be able to say that, oh, you do proBNP, pakka, this will show.
True.
Like, so sometimes there could be a little bit of enlargement, but the proBNP could come normal, and then we wait, we keep monitoring. Okay, that's how it is. But yeah, a complete check is like, so a clinical examination with proBNP and an X-ray should suffice initially, and unless we find something on this. But if you find something, please get an echo done.
Okay. So echo is not needed for if annual checkup somebody is doing. So is it fine if
Under
they get
six,
an echo done or
under 6 to 8 years, not necessary. But
okay.
I would suggest get the X-ray and the proBNP done.
Okay. Okay. So the next question is how effective are therapies like hydrotherapy, laser therapy, or acupuncture for dogs with joint and muscle issues?
So they are quite effective, but like I was mentioning previously, they're adjunctive therapies. So while there is, so basically,
So
this
if you
is
could
to
just
reduce the
tell us what is adjunctive therapy.
adjunctive as in like that. So I'm basically putting them on medication, but along with the medication, like either along with the medication, I need something else, some external stimulation to be happening, or I want to reduce the amount of medication that I'm giving, like say the pain relief, because whenever you do hydrotherapy, when you do laser or acupuncture, there are also, like I was mentioning, endorphins are released in the body, so they kind of help with alleviating pain.
Hmm.
So that is where these help. I have seen it when I was working at Crown in Mumbai. We had the stray dog who met with an accident. She had a bad, like, broken hip, and she was kept at the clinic for 3, 4 months. And with acupuncture, regular, massages and all of that, with medication and supportive
Again,
care,
synergy
she was able to
with
walk.
other things.
Yeah,
Yeah.
so synergy. So she was able to walk. But I cannot attribute this to one thing saying, we just did hydrotherapy or laser therapy or acupuncture and that's why she recovered. No, it was a combination of everything. But we have seen very good results with, say, mild cases of arthritis. May you just want to keep on a joint supplement, some lasers therapies. It will work. Hydrotherapy is one thing that I would suggest everybody just adopt because one very good exercise. Overall, body is involved
Hmm.
in doing it. It's
The
you're not
heart
doing anything.
works well. Just
Yes,
yeah,
yes.
it's very good.
And they feel light, so the joints are taking much less strain at this point. So even if somebody wants their dog to lose weight, hydrotherapy is something because if excessive walks and all of that, immediately you will not be able to do that. So with changes in the diet, please consider hydrotherapy.
So just to
So
make it
that is something.
clear, like hydrotherapy and swimming, like what is the difference?
So
Hydrotherapy,
hydrotherapy, huh.
huh?
So hydrotherapy में you will have this one rectangular
हाँ.
tub like thing, like how we
Hmm.
do it in humans,
Hmm.
right? For
Hmm. Hmm.
rehabilitation. So hydrotherapy is not just swimming. I think Penny.
She is able to slide. She's like, मेरा बारे में
I'm
session हो
sorry.
रहा है. Why am I not included? See, she came in when we talked about swimming and hydrotherapy.
Yeah. So yeah, so hydrotherapy mein in this one thing you will also have like a treadmill kind of a thing. So it helps with your balance, it helps with mobility better.
Hmm.
So starting off with swimming is good, but then later on, if it's like a more severe
Hmm.
case wherein very bad arthritis and we want to work on that, or even in neurological patient like somebody's hip was bad and they now they want to
Yeah.
rehabilitate them. So basically, hydrotherapy is rehabilitation. Swimming is just your regular, for overall health, you're doing it. But if there's a particular condition your vet is recommending it, it would be hydrotherapy wherein you have like a tub of with a treadmill proper, like, and then there is water and all. So that also helps with balancing. Like underwater, they'll need to
True.
balance. Slowly, it increases space.
So
So it's
how frequent
basically
do you suggest, like if a dog is going for regular swims, is
hmm.
still hydrotherapy
No, no, no,
required
no,
or
no, no.
no,
That
right?
is your hydrotherapy
Huh.
then. So just
Yeah.
swimming is your hydrotherapy
But
then.
I think
It's not
there
needed.
are some dogs who are scared of swimming in water. So I
Yeah,
think
yeah.
hydrotherapy can be a very good
Yes, so
option.
because it's a smaller, but
Yeah.
again, you need to make sure that the pet doesn't freak out because it's a
True.
small
Positive
enclosure, right?
association, yeah.
Yeah, so we need to keep some toys. Parent has to be
So
there and
how frequent do
slowly
you suggest that people should get this
swimming.
for?
See, depends if it's like an obese pet that you're trying to have them lose weight, and I would say at least 2 times a week you can start off. If not, at least once a week. Definitely. So that
We
is
are on
something that you
track.
can, yes, that should suffice. That should suffice because they're otherwise also getting a lot of exercise at home. And also, with all of this, we shouldn't forget about mental stimulation.
True, yeah.
So, even when you take for a 10-minute walk, if you're letting your dog sniff
Sniff,
properly,
yeah.
do them when they come back home, you're letting them shred something like a cardboard box. Mentally, you're keeping them, give them some toys and all of that. Mental stimulation is something you should never forget. Like enrichment of environment is never replaceable. So all of these we will do, but regular exercises with their walks and all of that, and mental stimulation, you have to continue doing it.
Like taking them just as small as taking them to a park or a
Yes.
lake for a walk. It really, because I've seen a very different Penny when she's on it, because on a regular walks, it's like a very familiar surrounding for
Ha,
her.
yes,
So some
yes.
days she is very intrigued, some days she's like, okay,
Ha,
ho gaya, let's go.
ha.
But if you go for, to a lake or a park, then
Hmm.
though she's like very different. Like it's very natural and everything. So that's so important. Like
Yes,
taking on
yes.
something outdoors.
Something outdoors, yeah. That is very important.
Yeah, so I think you've already covered this, but just maybe if you could repeat it.
Hmm?
Do you recommend any supplements even if a dog is already on a home cooked species appropriate diet?
Uh, so my question here is, what is your species appropriate diet? Because this is one term that I see people have been throwing and trying to, lure pet parents in and being like, so these are things that vets absolutely don't like because, like you go on to bash, food that is already made for pets. Like I know like many parents are not pro
Kibble.
kibble diet,
Yeah.
but that's not the monster that you're making it out to be. All of my 4 cats are on kibble diets, but I am never forcing anybody to keep their pet on a kibble diet. But if you want to do a home diet, so species appropriate, like I don't understand. What do you mean by species appropriate? Like, is it like you don't want to give grains, you don't want to give vegetables, you don't want to do leafy leaves and all of that? Because that is not what a species appropriate. We also need to understand that we have domesticated our dogs,
Hmm.
and with domestication, things have evolved. Like now they're able to digest grains. They have enzymes to be digesting grains. They need to obviously they need to be on the right amount of protein intake has to be there. They need to get their supplementation because otherwise if you see otherwise there will be other issues. Like if you say I will only my dog is a carnivore or an omnivore, I will only keep them on vegetables and chicken and not give any grains. There are studies, like even kibbles may they tried this gimmick and then that there were some pet grain-free diets that came in between. So what happened? It affected pets adversely because there was dilated heart. So there are micronutrients that are required to keep the heart functioning properly, like taurine. So they were deficient in that. So instead of saying they're on a species appropriate diet, I would prefer to say if you're keeping your pet on a balanced diet, okay, then there's no need. So, but you need to make sure
True.
that your pet is on a balance. So I have unfortunately only seen one nutritionist who has given like a chart with the micronutrients also written, saying that, and they'd given like 4 or 5 of those options, saying that, this meat, this meat, this meat, this much micronutrients and all of that, because everybody only talks about protein or fiber,
True. Yeah,
carbohydrates.
the
Yeah.
bifurcation is very
Yes, yes.
important. Yeah.
But when you speak about adding nutrients, adding a supplement to your pet's food, I will be talking about adding a micronutrient. Is your nutritionist or is your food balanced in that? If it
Absolutely.
is not, then absolutely you
Like,
have to add a
I
supplement.
completely agree with you because, maybe a year back or so, I was very anti-cable ki nahi, nahi,
Hmm.
it's very bad, it's packaged, it's processed. But when I saw instead of that, like fresh food is highly abused. This term is
Yes,
so
yes,
abused. In the name of fresh food, people are feeding their dogs absolutely
yes.
imbalanced diets. When that is the case, when you're not able to, for whatever reason, you
Yeah.
can have a reason, budget constraints or whatever.
Hmm.
So I think, like as you said, then supplementing plays a very good role
Yes,
because
yes.
you can
Because
say ki I don't want to add any synthetic supplements, but the dog is not getting that nutrition in the food
yes,
also. Then what is the
what is the
point?
point?
Then there will be deficiencies. So
Yeah.
yeah, this is very
So,
important.
yes, and we need to stop telling or, shaming people for the choices that they make. I
Absolutely.
am not shaming anybody for wanting to do species appropriate diet. That is the best thing to do. But that's not right. Like the way that influencers and other people are using it is not right. They're trying to fool you, basically. That is what is happening. And kibble that, like, say, I cannot cook meals for my cats. And like, see, in between, because somebody was at home, like we had a guest and they were feeding my cat excessively. And he got a little obese because for 3 weeks he was just getting free food. And then I had to put him on obesity diet. If this was like, if he was on a home cooked diet, it would be a little too difficult for me to do that.
Hmm.
And some issues will be there wherein, let's say, some gut issues like IBD or something. And in those cases, it's very difficult to tell you what to do at home, like with the food that you're already giving. So instead, I would want your pet to be on a gastrointestinal kibble diet for a very short time until the symptoms settle down.
Hmm.
So you should be open to that. So things like that will only happen when you have trust in your vet. Okay, so like
Yeah, I
I
mean,
know it is.
anything should not be
Yes,
about vilifying one particular
yes, yes.
professional and worshipping the
Yeah,
others because I have seen that this trend is very very like popular now that if you want to promote one thing, you have to bash the other. If you want to
yes,
bash, promote that, then you have to
yeah.
bash this person. So, to be honest, I mean, not gloating at all, but this is
No,
the
no.
reason I wanted to start Snouters Digest because
Ha.
these conversations need to happen. That,
Yes.
following the advice of a vet does not mean you should vilify a nutritionist.
Yeah, exactly. You
Following a
don't have to.
nutritionist does not mean you have to vilify a vet.
Yeah.
Both can work in conjunction, and things can be good. Like I remember
Yes.
in
Yes.
Nutkit session, this is what we spoke about, that there are both should, like you should have that brain to work together with both.
Yeah.
So thank you for addressing this. It's very important to
Mhm. Like,
understand both perspectives and
yeah.
then decide for your pet.
And
Yeah.
again, here in India, it's not like there's no regulation who can call themselves a nutritionist. And when I see bad nutrition plans, I feel bad. Like it's a genuine feeling. But when I see a good one, I will definitely recommend that. So when I was working at Crown, I remember one of the clients had communicated with somebody, contacted somebody in Mumbai, and she found a balanced diet for her pet. So the dog was close to 40 kgs, and she brought her Labrador down to 30. And in a year, she did that, and that was amazing. So I have
Yeah.
given out that number to so many other people
Yeah.
because that is amazing. Like she's doing a great job. Okay, and like I mentioned, like I have seen another, like if you, and these are things that you need to, like how you would be questioning your vet, you should be questioning your nutritionist also. Like where are the micronutrients? How are you balancing that? I think Sparkle's mom was also somebody who's very like, I will sit and question you about this. But that is what is needed. Only then when I do my job properly, when the other person also do their job properly. Like
Absolutely.
I
That
will not be
openness
like,
is what is required.
yes, I shouldn't be like, oh, I can fool this lady. I can get away with it. Like, I can say some nonsense and be like, throw some terms like, species specific and all of that and get away with it. No, that should not be the cause. When they ask you questions, you should be able to answer. If you have people like that, please trust them. But if not, then if you're planning to also do something at home itself, there are a lot of other foreign vets who are dietitians, nutritionists who are doing free classes. They do at a very nominal fee. They do super master classes and all of that. Please register for that, and they will give you an idea as to how you can make food at home, because they're also, see, even those nutritionists, despite being vets, they're neither pro kibble then nor pro home food. They're both for both. Whatever you can do is the best thing that you should be doing for your dog,
Yeah.
right?
So
Yeah,
even,
so
there are ways if you feel that kibble is not
yeah,
a very nourishing meal, there are ways to add nutrients to it.
yes,
Like we
there are
said, add
toppers.
supplements. Because I remember Georgina did a whole series on this, how
Hmm.
you can, if you're on a budget, how you can, how the best way you can balance the food. And even if
Yes,
it's kibble
yes.
and you feel it's not nourished, add this,
Hmm.
add that. So
Yeah,
that's what I think the question demanded. And
yes, yes.
we've spoken in length about it. I'm so
Yes.
happy. So I'm so glad I'm able to have these discussions with a vet,
Thank you.
because it doesn't feel like, that I'm talking to a vet. It feels like
Yeah.
I'm talking to a very open-minded person.
I'm also a pet
Yeah,
parent, right? So
true.
I go through the same anxiety issues when it comes down to my own pets. So I am also thinking constantly, like, am I doing something wrong? So that's the reason, despite me having 3 meals of dry food, they have 1 meal of wet food. I'm not compromising entirely. I'm doing my best. And if
Hmm.
I notice that, and also like my routine annual checks for my cats are thorough. Like I will do everything. I also do that. It's just like 2.5 to 3.5 years. But I will still do their heart check. I will still do their sensitive kidney HDMA checks. I will do their urine check. Everything will be done because
Hmm.
I know at some point I could be missing out on
True.
something
Yeah.
because they're on a different diet than what I would ideally want them to
Yeah.
be on. So I
I
don't want to
think
take that risk.
these things also change with age and the
Yes, yes,
body of your dog, right?
yes.
Your pet. That something that was working a year back.
Might not.
I remember in Georgina's session also we addressed
Hmm.
this, that it's important to understand your pet's health and accordingly make these
Yes,
changes also. You
yes.
cannot keep feeding the same diet like 10 years
Yeah.
later or 5 years later when the
Yes. So
body
in
has changed.
that problem arises in kibble
Hmm.
because there's just puppy food and adult
Yeah,
food. There's not like a geriatric
true.
food or anything. So
Yeah,
you need to change the amount of protein. You
absolutely.
need to change the amount of
You need to
carbs.
add things
Yes,
and
yes.
supplement
Remove
it.
certain,
Yeah.
yes, that is there. So there are bad disadvantages with everything. So we just find a common ground and be like, this is what is
Yeah, I
working for my
mean,
pet. Yeah.
take the knowledge and balance it the
Yes,
best
that's
you
what.
can. A very, very good point to talk. Okay, coming to my favorite point now.
Okay.
Two favorite segments. I
Okay.
was waiting to come into these vaccinations.
Okay.
So now we are going to come into that. What is the importance of vaccination in pets? Is over vaccination a health scare and has
Mm-hmm.
catastrophic impact on their health?
Hmm.
How long do antibodies last for the first dose of vaccines, and which vaccines do you recommend on a yearly basis? So everything
Okay.
about vaccination,
Yeah, please.
summed up.
Okay. So vaccinations are they're not debatable. Like there's no debate about should I do vaccination, especially in India. There's no debate at all. Puppy vaccinations may
I mean, there
puppy and
is,
kitten
but there should not
they should
be.
not be okay.
Better
They should not
rephrasing.
be.
There is a lot of
So
debate, but there should not be.
they should not be. So I will tell you, people can make their decision for themselves. So as puppies, they will receive total of 5 vaccines. Three of are multi-component, which covers our distemper, parvo, lipto, and all of that. And then you have your rabies, 2 shots of rabies. Kennel cough is another one, especially here in Bangalore. We need to be looking into kennel cough because our dogs are exposed to a lot of other
Exposed,
dogs.
yeah.
We take them
Boardings
to
and
events,
everything,
yeah,
yeah.
boardings, events, all of that. And kennel cough is more of a young dog problem. So please get that also done. Post that, a year from then is when you will do the annual boost. This is standard throughout the world. Okay, so you do the annual boosters. Then on, what happens is the debate. Okay, so probably like because abroad may they usually do it, check the titers, do it 1 to 3 years
Hmm.
may. But here in India, you cannot afford to
True.
do that
It's like
because
I think
yes,
9 to 10K for
yes,
one
yes,
single
yes.
antibody titer
Yeah,
test.
one cost. Okay,
Yeah.
and the second thing is the rate of infection, like the amount of infection in our environment is so much that you cannot take the risk of, oh, I will not, vaccinate my. Of course, like December and Paro are young dog problems, but we
Hmm.
have seen them in like adult dogs also, like 3, 4 years
Hmm.
dogs also who have not been vaccinated. We see that. But the bigger scare is our rabies and lepto.
Lepto is on
Lepto
the
is
rise
like,
right now. Oh
my
my
God,
God.
Lepto was not so bad in Bangalore. I don't know what is
Yeah.
happening. Lepto is the one of the scariest things that can happen to your pet because it will immediately destroy your pet's kidneys. There's severe anemia, very low platelets, very high
Can
WBC,
be
white blood cell count, that's
fatal also many
fatal,
times.
very, very highly fatal, and it is zoonotic. Like it can spread to you also. So, and
Oh
you will go
yes,
through, yeah.
humans can also
Yes.
get it.
So
Yeah.
every time we handle a lepto case, we are always double gloved. We anyway take prophylactic antibiotics and stuff. So lepto is scary. So we should not be arguing about, should I be vaccinating? Should I not be vaccinating? Because we have so much infection here. Okay. Rabies again is very rampant here. Rabies, there is no treatment. At least lepto, you can think about treating your pet. Rabies, ke liye, there's nothing. And it will spread to you. And like,
My
do
God.
you really want to go through the guilt of, oh, एक prick के लिए I thought about and now my dog is going through this. Like, do you really want to do
So
that? I
basically,
don't think that's
I
the right.
think it's more because of this scare that I wanted to address. That
Mhm.
is like over vaccination is bad. Over vaccination can kill your dogs.
We've
These are the kind of reels that are viral these days. That you know.
not we've not seen anything of that sort. What we have seen is vaccine reactions. And those are also like say in maybe 500 cats, we would have seen one or two cats or 200 to 300 dogs, maybe one dog could have a reaction. And if there's like a repeat reaction, what we do is then we recommend doing like absolutely prevent your dog or cat from coming in contact with other dogs or cats, especially strays who could be just carriers. Like they could be immune to it, but they could still be carriers. That is one thing. And the second thing is, then we say you can do it in once in 3 years because that's what's standard. And again, titer checks are necessary in that case. Like in case I find that the titer is low, then I have to immediately vaccinate your
And
dog. That's
how effective are like titer tests in Indian labs? Are they like effective
I have
and very
not
accurate?
seen. So the only titer tests that we've done are the rabies titer tests that we send outside for the, like when we're exporting pets. But all of those, like the countries abroad, like US and Australia, all of them, they don't even accept
I
what we
know.
do here in India.
Yeah. So,
Yeah.
this is one discussion that just like last week we had with our
Huh.
vet because uh, good reaction on a very nice topic.
What was that?
So, this is something that happens on iPhone, with this.
Okay.
Very nice in Apple, good. So this
Okay.
is what discussion that we had last week because I was talking to him about titer
Mhm.
tests and the effects of it and the efficacy of it. So he also said the same thing
Yeah.
that once you're moving your dog abroad, they don't accept
Yeah.
titers from India or they will do their own testing and that
Yes.
costs like if you
It's
want to get it
very
done 30
expensive.
40K for one
Yes. Yes.
antibody. So,
Yes.
and in India also, like, I mean, I don't think so. The worst part is that if we keep having these discussions now, oh, vaccination will kill, don't vaccinate. So,
Mm.
what most people will do, they will not be able to afford a titer,
Yeah,
right?
they
Like,
won't.
4 or 5
They'll
titers, they will have
just
to get it
stop.
done,
Huh.
and they just not
Stop.
vaccinate.
Huh.
So, it's
So
harmful for them,
the
for their
pet.
dog, for other dogs also.
Yes, yes. And like, see, I will tell you the extent to which, like, I don't think we Indians understand how bad rabies or lepto and all of these are because,
True.
so I am planning to move abroad, like to Australia, and to move my pet to Australia, I cannot move them directly from India
Yeah,
to Australia. I have
yeah.
to
Just yesterday,
quarantine
we
them.
saw one
Yeah,
post on our SQS
six
page. Yeah.
months. I have to keep them 6 months at a different country like Dubai and
Dubai,
then to
Singapore,
ship
yeah.
them to Australia again, keep them on under quarantine. So that's how scary these diseases are. So we need to start looking at them as scary as they are. Like they are scary. Uh, Over vaccination, how it would affect us by because it's eliminated through the kidneys, it could be affecting the kidneys. But if you're doing your regular annual checks, then I have not seen, like honestly speaking, I've only seen vaccine reactions. We've not seen somebody die of overdosing. This is again everything like with social media, people are just picking up on things and making
It's
reels. That
all
is what is
about
happening.
just what if
Yeah,
assumptions and
yeah.
scarings. That
But
is
what
what
if
is
your dog,
bad.
yeah, what if your
Yeah.
dog gets lepto? Like, what if your dog gets rabies?
That
What will
is
you do then?
more
Yeah.
bad than the risk of over vaccination
Yeah,
that
you can
happens
still,
once in like a million.
exactly.
Yeah.
So it's absolutely, we should not be discussing about this. Like, there shouldn't be any debates. Unfortunately, I know if there was a possibility that I could vaccinate your dog once in 3 years, I would definitely do it. Like, that's something that's ideal. We would have done it, but we don't have that option. We don't have the luxury to vaccinate our pets once in 3 years. So that's the reason senior patients, post 10 years, what we say is we can do the core vaccine, the multi-component vaccine once in 3 years, because by then they're usually quite resistant, but still the risk of lepto is there. But rabies, we still do it every year. So
So
that's how
yeah, this
scary the
was the
injections are.
part of the question. Like,
Hmm?
which are the boosters that we get? What are
Yeah.
like we know that when the dog is like first time being vaccinated, we have canine
Yes.
coronavirus, rabies,
So
lepto, and FHSC.
Corona, funny enough, Corona is not really a core
Yeah.
vaccine.
No, I mean
Okay.
it's a part of like a
Yeah,
mix
no,
that
I know,
comes
I know, I
with
know.
three, four
So,
vaccines. Yeah.
so it's I think post-COVID, everybody started freaking out about corona, distemper, parvo, hepatitis, and your lepto. These are your major
Rabies.
ones.
Yeah.
The DHPPI with rabies, and now the kennel cough also.
Hmm.
So these are something that you should be vaccinating against. Kennel cough is once a year again.
Yeah.
But if you're exposing your dog to too many other dogs and or going to multiple events every month or every 2 months, you're going to events, or if you're boarding your pet somewhere, please get kennel cough also done. It's an
We get it
intranasal
like
thing. Yeah.
irrespectively because
Yes,
Penny
yes.
is a social and an
She goes,
outdoorsy
yeah. And
dog.
she's a
So
swiffer, no?
yeah, I think Beagle parents so
Yeah.
definitely should get this done because
So,
I have
yes.
seen even when she was vaccinated, still she got kennel cough because
Lucky,
but it just got cured I think within
yes.
a day
Yeah,
because she was
luckily it's a
vaccinated.
very mild.
Yeah.
Even otherwise, it's usually mild. Like it lasts, it's like our flu. It lasts for a few couple of days. And then the problem with the kennel cough thing is, it's a kennel cough is basically caused by a bunch of organisms. There's
True.
bacteria, virus, and all of that. But the vaccine is against Bordetella,
Yeah.
the major one. So that is something we need to remember. We cannot say that once we
True,
vaccinate
because
against kennel cough, there's
there are
absolutely no
multiple
way.
strains, right? And the
Yes,
vaccine
yes.
is not. I
Yeah,
hope some
that is
vaccine
there.
comes for tick fever. I'm so
Tick
tired
fever,
of hearing the
hopefully.
cases.
Lyme disease there is, but Lyme disease is less here. Babesia, those are the ones that are more here. Sorry, this I think somebody's asked about preventive
Yeah,
rabies vaccine for
for
humans. There
humans.
is, yes, yes, there is humans. So even we are recommended, like vets, whoever gets exposed to pets regularly, we're recommended to get it once a year. Please get that done. Especially, I think if you're Indian street dog, somebody who comes in
Yeah,
contact
I
with them,
think so. The
please, please
point to
get
note
that
here
done.
is that if you are a rescuer or a
Yes,
shelter
abs
person or some a regular feeder,
feeder.
so but because I
Yes.
think normally like pet parents who are just dealing with their dog
Huh.
or maybe a couple of them, they don't
They
need it.
don't need to,
People who are
but
very
unless your
actively.
dog comes in contact with a stray dog on a regular
Uh,
basis, or like, there is a possibility of conflict there, and you'll
hmm.
have to, in between, like, you'll have to break a fight, and, then the dog could bite you. If
True.
you know, or if you're somebody who's feeding dogs regularly and you know that there could be a chance like that, just get your routine, because otherwise, if you get bitten and you go to the hospital, then you'll also have to take, with the vaccine, you also have to take the immunoglobulin. Like, 2 days back or something, one of our team members got bitten, and despite that dog being a vaccinated dog,
Vaccinated.
it was just a pup, it was like 11 months or something. She still had to get immunoglobulins, and I mean, it's unnecessary. So it's better to have prevention, like always, better to be on the safer side. So vaccines, yeah, these are the core vaccines. Please get the core vaccines done. Rabies is a core vaccine. Kennel cough, depending on how much your dog interacts with other dogs and boarding and all of those things. But otherwise, everything else is non-negotiable.
And in the boosters, which all are given,
The
which all vaccine?
multi-component again, the DHPPIL and rabies.
So,
These are the core vaccines. Corona is not a core vaccine.
hmm.
Unless you want to get it done, you can absolutely get
I
it
think
done. But
Corona
it's
is
not like a
given
core.
just that first time when
Just, yeah.
it comes.
So it's not a core vaccine. Annual boosters, these are the ones. No need for anything else.
Okay.
Previously, actually, there were like lepto used to be done once in 6 months, but now the strains of vaccines that they're releasing, that will last for a year. So the vaccine companies have confirmed that, so they no need to worry about that. Once in 6 months is not needed.
So that's like covered in our
Yes,
annual
yes,
booster. So,
yes, yes.
and it's the question also says how long do antibodies last for the
1 to 3
first
years.
1 to
So the
3 years?
first dose, if it's the puppy, then you have to re vaccinate them. Then 1 to 3 years, but cannot say because it could be 1 year, it could be 3 years. We
You
don't know
will
unless
not
we
know
check.
unless you
Yeah,
get an antibody
unless
test done. Yeah.
yes, unless the titer is done, you cannot know.
Yeah. So, do senior dogs need annual booster vaccinations? Because there is a lot
Yeah.
of talk around this also that because they are
Hmm.
seniors, so don't
So
get the boosters.
again, it's not like I was saying, we don't do the multi-component. The DHPPI, we don't do it every year once they cross the age of 10 years. We do it once in 3 years, but rabies is, yes, rabies you have to get it done.
So, like they don't have the chances of contracting distemper or
Lepto, there is
lepto.
still distemper and lepto, there is still a high chance. But distemper and parvo, the body would be better, equipped to kind of deal with it. So at that stage, it's not very common to have parvo cases or
So,
distemper cases unless they're already
lepto is
exposed.
also covered for them
Lepto, yes, yes. So lepto
booster.
is something that is needed. So that again, based on how much your dog is getting exposed to outside
Hmm.
environment, like let's say sewage water, or even just walks पे,
Lakes
gutter के
and
पास,
yeah.
yeah, lakes, gutter के पास लेके जा रहे हैं, all of those things will affect, whether we do the lepto or not.
Hmm. How can we prevent and treat water-related issues like ear infections, especially for dogs that love swimming?
So previously we used to say plug cotton, but that doesn't seem to work because the cotton just gets soaked. So post the bath, because you need to remember that ear canal is like this L shape. Okay, so no matter how much you do on the outside, you're not able to get to that other hand of the L.
True, true,
So
true.
use a cleanser. Like you get the
Salicylic
salicylic
acid
acid
cleanser.
cleanser because that will foam it and then give a good massage under the ear. That will bring out everything that is there. Just
Oh,
dry off the
like
ear and that's
here,
it. Will,
back of the ear.
yes, at the back of base of
See,
the ear.
again, new
Yeah,
information, guys. This
this
I
should
did
be
not
very
know
common
this.
knowledge.
Yeah, I'm so
So that's where
surprised I
you'll be
didn't know.
able to, because otherwise, if you just pour, then you're not bringing out what is on the inside. So all ear cleans have to
Oh
involve.
yeah, the massage
Yes,
during that,
yes,
na,
yeah,
yeah.
that's
Because
that's
I've seen
involved.
most people they put it on a cotton pad and they clean like we clean ours. That
So that
doesn't
will
help,
not
yeah.
that will not help. But if you're better somebody that's very sensitive around the ears and sudden drops in their ears might kind of freak them out, what I would suggest is take it onto a soak a
Hmm.
cotton ball, place the cotton ball there with your finger there, and then give a
So
massage. So it'll slowly drip in and then bring it out, but then you have to remove it.
Penny to
So,
loves that ear massage
oh my
session.
God,
If
you're
I,
lucky to.
yeah, so she'll run away when she'll see me bringing that bottle because she'll get. But once I do it and I do it, her eyes will
She's like,
close
oh yeah.
and she'll keep sitting and I mean because this is very relaxing for them.
Yes,
This
yes,
ear
yes.
massage.
Beagles are usually very protective of their ears and
Yeah,
paws.
she
Yeah, we're
is. She is.
very
If
lucky.
she sees me opening the drawer with that bottle, she'll run away. But once I start doing it, then with that massage, she gets
She's
comfortable.
happy.
Yeah. So, what joint supplements do you recommend for aging dogs?
So depending on how bad the arthritis is, as a supplement, just you can use something as simple as pet joint, which have lesser concentration of chondroitin, glucosamine, and all of that. But if it's like very like a more severe case, then supplements like chondrovet they have better concentrations, and there are some enhancer. Enhancer is one supplement that has MSM. So MSM also has anti-inflammatory and pain relief qualities. So if you have a bad arthritis dog, so to reduce the amount of pain relief that you would be giving your dog, you can use something that has MSM. So this is how you would decide. But as a routine thing, like say your dog has just crossed 6 years or something, and you want to just keep them on a supplement, you can start off with something as simple as pet joint. There are many available. I can't remember the names, but pet joint, the basic ones, and not the very expensive ones. But make sure that there is some research on that because
And you can
randomly
also
there's
clarify because I think many people joined late that calcium
uh-huh.
is not the only
Calcium is
supplement
not.
that needs to be
Calcium is
given.
not going to help with joints. Calcium is only with
Developing
growing,
bones, yeah.
developing bones. Uske baad, unless there is a deficiency, there's no way calcium is
And
helping your pet. It could
over
actually,
calcification
yeah, it
can,
could
yeah.
actually cause imbalances because when calcium increases, phosphorus decreases. So it could be causing, you could be having negative impacts because of the
And we
increased
seen the
calcium.
poop also, right? The
Yeah,
poop becomes whitish
yeah,
when there is a lot
yes.
of calcium in the body.
So that is not needed. Oh yeah,
Without
basically
studying,
it's just
I'm
that.
0.05%.
You have a dog.
Yeah, everybody,
Yes.
these basic things, that's what these sessions are for. These basic things
Yeah.
everybody should know.
Yes, yes.
Uh, then it's like navigating pain identification and management in places where vets may not be well versed. What questions to ask?
When the vets are not well
Yeah.
versed. So this is basically about pain, right? Like how we identify pain. So it is important that you first identify pain. So if the vet is not able to, because you will be seeing the pet more, or could be like a fresh vet, multiple reasons.
Because there are many
So,
times I would like to
huh.
address where in the clinic the dog seems fine.
Yeah,
Maybe
absolutely
because they
fine.
are beagles ke sath I've seen this. They'll be, oh, no, nothing happened to
Nothing
me.
happened.
And at home they will show real
Yeah,
symptoms.
always make
Hmm.
videos.
Hmm.
So any abnormality, make a video so that the vet is able to understand. Like even sometimes they speak about rapid, like abnormal breathing and all of that, and we are not able to understand what the pet. And usually they will be explaining something, and we will be understanding something else. Okay, so it's important that you make a video, like say a limping, or when you're touching the pet is showing some, like they twitch a lot, or they try to kind of be like, oh, please stop that, kind of a thing. Make a video. Once you've understood where the pain is, maybe ask for a joint examination. So usually what is supposed to be, you can also do this at home. What you need to remember is, say that pain is here, you should not be starting your examination here. So you need to start from the end. So where the pain is not there. Because if you already trigger this point, then they will show pain at all points. Because you've already shown that, you've
Hmm.
made them feel painful. So start off with the extremities usually.
Matlab, not
Very
where the pain
not where
is,
the pain
somewhere
is.
else.
Yeah, somewhere else. So usually it is in the hip or like the knee, right? Or the elbow joint. So start off here. And when you're slowly flexing and extending, I think we should share the video. Slowly flexing and extending. If there is any discomfort at that point, and say it's in a, they're ideally supposed to go this much, but as soon as I bring to this point, the pet is not folding this anymore. This they will do even at the vet. Even if they're walking normally, this is something. So if you know this, then you can just show this to the vet. These are symptoms that you can show them and be like, this is happening. And otherwise, like somebody's asking also about, like, when vets don't take it seriously, there could be symptoms like, they're skipping their meals a little, or they're eating much less, or they're not walking up to their bowl, and if they're also becoming a little cranky, like we were discussing earlier, these are symptoms that you need to tell the vet. And you can ask them to start off with a simpler pain relief. Like, don't go for something that would affect their liver and kidney. Ask them to put them on something that, like gabapentin. Gabapentin is something that would work for neurological pain mildly. If there's like a behavioral issue, also it will help with that. So please talk to the vet about that and make sure that you have your proof that see, now he's not bending it down. That the vet cannot deny, saying that hey, it's okay, it's not normal, it's normal.
True,
They
true,
cannot.
true. Yeah.
So please, and be firm about what you're asking. Like, you're paying the vet, please ask for what you're
Yeah,
paying, right? So
definitely.
never be
So
like, no, no.
identifying and asking
Yes,
questions, very
yes,
important.
yes. I think Angel also. So shall we address this later, or do you want to do
Yeah,
it
we'll do it
as
at
we?
the last
Ah, okay. So we'll
session.
tell
Yeah.
everybody.
So, yeah, this I also had in mind. Are certain dog breeds or active outdoor loving dogs more prone to tick fever?
Ah, so it's basically they're more prone to ticks and
Hmm.
hence tick fever.
Hmm.
Nothing like particular breeds are prone to tick fever. Everybody is equally prone to tick fever. It's basically like, dengue. Like everybody is prone to it. If I am a little healthier, if my immunity is a little better, then I would be able to recover from it faster. That's it. That
Hmm.
is basically like I am on a good diet, I am exercising normally, properly, and all of that. So I will be able to recover from it better, and early detection. So if
True.
I've detected the infection early, because tick fever can happen in multiple forms, multiple organisms can cause it. And if you delay the diagnosis, then there will be so many weird symptoms, and sometimes it progresses to things like immune-mediated hemolytic anemia, and the body is just destroying the blood cells.
Hmm.
So detection is important. So there's no particular breed that is more predisposed to tick fever, just that these dogs who go out more often, they are more prone to ticks and hence tick fever. But if they're on tick preventative and they don't let the tick latch onto them for too long, then they should be
And I
okay.
think, as we addressed previously, if your dog is going out a lot, going on adventures, it's even more important to get a
Yes,
good tick prevention
tick
done
preventive.
take better care of things and focus on this,
Yes,
like
yes,
rather in comparison to dogs who are indoors a
yes,
lot.
yes, that is true.
What causes a relapse of tick fever after a dog has already been treated? Does a relapse indicate that initial infection wasn't fully cleared, or is it a new infection? Are some strains of tick fever like Babesia more
Hmm.
likely to cause relapses than others? And does the strain never leave the blood, and a dog once infected is always at a health risk?
Yes. So I think I'll go backwards because when I discuss about Babesia, the rest of the questions will get answered. Babesia is very prone to relapsing because see, it's not always because because the initial infection was not cleared. Babesia is known to stay in the body. Okay, so but how much of the organism is in the body is what matters at that
Hmm.
point. So on a PCR, when we are looking for Babesia organisms, what we're looking for is an amount. So when we run the number of cycles, so within these number of cycles, if I find the organism, that means that I was able to find it very fast. So the concentration is high. So beyond that, even if I find it, it's like I would consider it as negative. Gibsoni especially is an organism that is seen to just stay in the body in a
The
latent
rascal.
state. Yeah. Absolutely
Oh
will.
my god.
So it just stays in the body. And if say it also depends on when the relapse is happening.
Hmm.
Like, are you saying that the like you do the treatment and then within a week when you recheck the PCR, which you ideally should be doing, if it's still the organism is still present, then that means that the therapy that we have been doing is not working properly. So then we might need to change the therapy. But if it's say like 6 months later, like there was an immunocompromised state, like some issue happened and the pet had some concurrent infection going on, and that's when tick fever happened because many a times this happens. Then it does not, it's not because of the initial treatment. The treatment had worked, but because the body was immunocompromised,
Hmm.
the organism was able to take an upper hand. That's how it is.
So
So that is when
I
we have to
remember
differentiate.
like there was one pet parent whose
Hmm.
dog got tick fever,
Hmm.
this Gibsoni, and
Hmm.
then got cured because
Hmm.
the pet was on a good diet and with
Hmm.
medication it got cured very fast. But then again the relapse happened, and
Hmm.
even then the cure happened, like again the same set of
Hmm.
antibiotics and medicines happened for the second time,
Hmm.
got cured. The third time, I think the pet parent went just for a regular checkup
Hmm.
because they were going on like a trip or something. So the platelets were fine, everything was
Hmm.
fine, but I think I don't know the reason why they did a PCR.
Hmm.
The PCR again came positive,
Huh.
but the dog was showing no
Now
symptoms.
that's what.
So in that case, should again medication and
No,
antibiotics be
no,
done,
no.
or you don't need to?
First we need to understand when the relapse happened. Was it like very immediate? Like was it immediately after the treatment course? Like say within a month, then I don't think the medication had completely cleared the infection. That's the reason we need to do the PCR to make sure that we've cleared the infection. That is one thing. The second thing is what antibiotics were used. Were the same antibiotics or medication used the second time or not? Because Gibsoni, usually there is a way that you need to approach Gibsoni. So the first step is a set of antibiotics. The second step is a different set of antibiotics. The third step that means that it's resistant to everything else. So I'm using injections, which are like very, very strong. So we need to understand if the same thing was repeated, then it is sort of it becomes a little pointless because then we're not we to something that is resistant. I'm giving the same thing.
Hmm.
So that wouldn't work. And the PCR could have come positive. Like I was saying, a latent infection can also show
True,
up.
yeah.
So in that case, just make sure that the immunity is good. So use an immune booster. The diet, obviously, you will be
Because
keeping.
as you also said, and we know, right, Gibsoni stays in the
Yeah.
blood. So it will always come positive.
Yes.
But if there are no symptoms, then I
No, no,
don't think
no.
the
It doesn't.
medication is
Sorry. It doesn't always come
okay.
positive. So like I was saying, see, if you remember, like during COVID, we were also getting our PCRs done,
Yeah,
right?
yeah, yeah.
So I could come negative on the kit test, but I could come positive on the PCR
True.
because in on the kit test, it is measuring much less antigen than what is checked on the PCR. So when they were checking the PCR, like the number of cycles that the PCR is running, if it's say 30 is the cut down, okay, and 29 they've found the organism, I wouldn't really want to worry much. But say 27 pay they've found the organism, I would worry.
True.
So the cycles are also important. So
Right.
the PCR pay finding it, it's not always true that, if one's positive, you'll always find it on PCR. But it is possible that, a very mild infection can also show up, but it doesn't need medication and you keep them on a good immune
So
booster.
because that parent was really worried, because each time the
Hmm.
doctor would ask, because she was like, "Ki, my dog is fine, he's eating fine, he has no
Hmm.
symptoms." But again, he is asking to start the antibiotics doxy, and they're very
Huh.
like hard
Yeah,
meds.
yeah, yeah.
So like going for it again and again. So she was very confused the third time.
And the
So
duration also, sorry to cut you, the duration, because tick fever treatment में Babesia gibsoni especially, some of the treatments go on for up to 30 days. And if we are not finishing that 30-day treatment and say 2 weeks pe I stop because the blood work, usually the blood work starts showing normal by two
very
weeks.
yeah,
And if I stop the medication at that point, then it's pointless that I've given so many antibiotics to that dog. It
exactly.
will relapse. So the
Because
second
in
time
humans
also,
also it's the same, right?
yes,
The
yes,
doctor gives, like, even if you're cured, people
yeah,
stop
we
medication
need to
once they
take.
see hum theek ho
Yeah,
gaye hain, but you need to do that 5 day
yes.
course.
And this is another problem because, like, many a times, what vets are also we are doing is without a PCR, we just see some symptoms and be like, "Ha, just do a week of doxy." That is not right. Like, you have to have some backup, or at least do the proper course of doxy for the tick fever. That is important. Like, have we done the right duration, the course? Have we completed the course?
True,
Because two
yeah.
times we've done, but what antibiotics have we used? If they were the same antibiotics, then it's pointless. If they were not completely done, like, for 3 weeks, 4 weeks, what you had to we were supposed to do, if you've not done it, then it's pointless. Like 2 times, 3 times, 4 times, it will. And the problem with Babesia is if it keeps recurring, then it will predispose the body to something called IMHA, like I was speaking. IMHA is immune mediated hemolytic anemia, wherein the body is just attacking its own blood cells. So then you have to put them on steroids and all of
I
that, and
know.
that is just, and IMHA is a scary thing because even if you transfuse blood, there's no guarantee that that blood will stay in that pet's body.
Hmm.
So that is the scary part about Babesia. So it can predispose your pet to a lot of other things. So please don't take it lightly that the second CBC has come normal, platelets look normal, dog looks healthy, so I'll stop the antibiotics. Please don't do that. So the complete course has to be done, and
I think we
repeating
need to
antibiotics.
have a separate session
Session
on
on
tick
tick
fever,
fever.
because I am not kidding. I got so many questions just for
Yeah,
tick
yeah.
fever. So
Tick
I
fever is
think we
scary.
will do it. One
Yes,
session
yes,
separately we'll schedule for tick fever, because many
yes.
dogs are suffering from it and parents are clueless, and there are so many different
Yeah,
advices
yeah.
all over. So we will, because I have more, but I don't think we should address all of them. We should keep a separate session for it.
Yes.
Okay, now coming to this, what are the benefits and risks of spaying or neutering dogs, and when is the best time to do it? Can you please share your insight on why pet parents are now being so widely discouraged from sterilizing their dogs?
Okay, so
Can you
I
see my
will talk
bonds?
about the. I don't know why there is again debate around this. It's basically um, it's your lifestyle. It's like your lifestyle choice, but it shouldn't be a lifestyle choice for like you get a vasectomy or not is your lifestyle
Hmm.
choice. But neutering your dog or not is not. It's not up to you to do that unless I think we have one question where one pet parent said that their pet has some other issues so they cannot neuter the dog, which is absolutely justified. So neutering again depends on the breed. Okay, so smaller breeds by 6 months of age, you can absolutely neuter them. Neutering, so I'll speak of it as spaying and castration. But larger breeds like retrievers and shepherds and all of them, they need to wait at least up to the age of 18 months because these hormones are needed for their bone and joint development. So if you don't keep it, then there are chances of hip dysplasia happening, other sort of bone and joint, not just hip dysplasia, but like stifle joint and all of this, the knee joint and all. Developmental abnormalities will be there. So we need to make sure that we're neutering at the right age. So have a discussion with your vet about that. Ideally think of it as large breed dogs, like unless it's like a Saint Bernard who needs to wait till 2 years. Usually in Bangalore, we have mostly retrievers, shepherds, and or small dogs. So small dogs by the age of 6 months, you can neuter them. Larger dogs, at least 18 months, 1.5 years. So that is the ideal
I
age to be
think
neutering.
that depends on like by small you mean the dog
Like a Shih
till when the dog is
Tzu.
growing.
No. Like a Shih Tzu, you can neuter them at 6 months also. That much of
Hmm.
hormone is enough for them. So I will tell you also why it is important that we neuter, especially female dogs before their first heat, because latest research shows that post the first heat, so one of the advantages of spaying your female dog is that you reduce the incidence of mammary tumors, right? But now the latest research says that once the first heat is done, then the chances of mammary tumors has remained the same. Whether you neuter them at the age of 2 years or 10 years, the mammary tumors can happen at the same age. So if you have a small breed dog, then why not take that advantage, use that advantage, then neuter them before their first
Plus
heat.
that
So they,
risk of pseudo pregnancy. Like I
yes,
know
yes,
Penny had it. It
it's
was the
horrible.
worst. Her pseudo went on for 4 months. We were not
Oh
able
my
to spay
God.
her, and so yeah. So she
Oh,
had the
the
milk in the
mammary
glands,
glands.
and she probably fed her foster puppy. We had a foster puppy
Oh,
at that time, so it's all sagging, and we were so scared because we
uh,
knew that we have to get
yes,
it done, but we were
yes.
not able to because
Able
she
to.
had
Yes.
pseudo.
So,
So and
so
again,
you
then you
have.
have to wait 1 month after
Yes.
that, and it was like I have never seen Penny in a worst phase, like emotionally, physically.
Yeah.
She gained 5 kgs.
My
Imagine a beagle
God.
gaining 4.2 kgs she gained.
Scary.
Yeah, because she was not going on walks, and people,
They
when
become
they
lazy.
have not suffered, they have not seen their dog suffer, so they don't realize how scary it is.
Yeah,
So
yeah.
that is and because of that again, like mammary tumor risk, as you said, it
Yes.
the female dogs. So you just cannot have this debate
Yes.
that I don't want
You
to do
shouldn't.
it, because I've seen that. I had one person in my community last apartment. Her dog got pseudo pregnancy after every heat cycle.
Oh
Every
God.
heat cycle. Imagine. So,
Mm.
and she was not ready to like listen to me, or and no, that is unnatural. I will not mate her, but I will
Pseudo
not.
pregnancy is also unnatural.
Yeah, that's what I'm saying. So, and she was not ready. And after every heat cycle, that poor dog would get pseudo, and
Mm.
that was like I used to feel that pain, but
Yeah.
I don't know how she was very comfortable with it.
So also we need to understand that pseudo pregnancy is a hormonal issue, right? So
Yeah,
unless there's something wrong with the ovaries also, we wouldn't be seeing so many. So with Penny, I think because we also had a foster puppy that could have made it worse.
exactly.
Okay,
So
so I
that's
went
what
there.
my vet also
Yes,
said, that otherwise
yes,
it usually lasts for like a month or
yes.
so. It went on for 3.5 months to
Uh-huh.
4 months, and
My
we were
God.
like so scared, and we were it was very bad.
Yeah, so advantages like you mentioned, pseudo pregnancy is one, mammary gland tumors is one, ovarian cysts, ovarian tumors. The biggest advantage would be pyometra. Like, you will be saving your dogs from pyometra. Pyometra is wherein there's pus accumulating inside the uterus. And that's one of the scariest things that you can have your pet go through because the toxins build up so much in the body that they spread to other organs and your kidneys, like within days, your kidneys, the dog's kidneys can get fried and can become also irreversible. And you will see visible change in a dog who has pyometra. You can neuter the dog, spay the dog, and by the very next day, with some fluid therapy and all of that, it'll look like a different dog. So you'll be eliminating all of these issues, okay, with spaying a female dog. Neutering a male dog, again, testicular tumors. You'll also eliminate a lot of prostate issues. Okay, so because see, in the end, if you end up having any of these, and so I'll just list them first. So also perineal hernias are very common. Behavioral aggression towards other male dogs that is going to come down, but the myth that aggression itself is going to come down is not true.
True,
That will not happen.
absolutely, yeah.
If your dog is protective about you, if your dog is protective about their resources, their food, and all of that, that is not going to come down. So if that is your reason to neuter and your expectation is that, please don't do that. You should also always understand that we're neutering for different reasons. Okay, so
Definitely. You
towards a
should
male
not
dog,
mix
yes,
behavior with
don't
that,
mix.
yeah.
Yeah, don't mix behavior with that. So all of these issues also will happen at a later stage in life. Okay, so say after 6 8 years, if you've had to now neuter your dog, there will be some concurrent issue, right? Because it's a senior patient now, there could be some heart issue, kidney issue, liver issue. So the anesthetic risk is much higher at this point.
Hmm.
And the only solution is to put them under anesthesia.
True, yeah.
So why would you want to do that? So otherwise, you like, how are you going to monitor your pet so rigorously that, so there are some people who say that, oh, I don't want to neuter them, but I will make sure that I'll do all the tests. Like today, you do your test. Within 3 months, your pet could have pyometra. I
Exactly.
cannot guarantee you that, your pet will not have pyometra for sure. I cannot guarantee you when your pet will have cancer. So that is a little like stupid. And there's no like people say that, I want her to enjoy the pleasure of mating. It's never pleasurable. Have you seen them mating? Like they
Oh
just get
my
locked and stay in that
God.
position.
This is like
Yeah,
one whole other discussion
yeah,
we can sit and have. How disgusting this sound when people
yes,
humanize dogs
yeah,
and
yeah,
they confuse human emotions with
yes.
emotions. What
Only,
emotions? They just have big feelings. They don't even have those
yeah.
emotions.
Like dogs and cats though, like cat penis has spikes on them, and when like the female cat screams in pain, and you think that is pleasure. That is not pleasure. See, except for humans, I don't think anybody does it for the pleasure of it.
Exactly. Yeah.
Everybody else does it for
Procreation.
procreation. If they were doing it, yeah, if they were doing it for pleasure, they would always mate, right? Why is it
And
that only
plus,
when they
why
come in
would they
mistress?
only seek for
Exactly.
pleasure and natural with one
Yeah.
type of breed?
Yeah.
That is so stupid, like to expect this. Like,
And they're only during estrus period they're mating. That is because that's the natural instinct. Otherwise, they
exactly.
just roam around like, they're two neutered buddies. They don't have that instinct. They only go after, females in heat. And the female in heat, females also allow only when they're in heat. Not even in pro-estrus will they allow the male to come mount
Hmm.
and do it. So that is how God, so that is natural for them. So unless you're able to give a good life to the puppies that are going to come out of it, why would you do it? Because most of the times you will not be able
Who
to do it. And home
I mean,
breeding,
youth,
yeah,
they say that they will be able to, they will not neuter. And imagine one litter brings 9 or 10
yeah,
pups on an average, 8 pups. So then those eight will have eight
eight,
each of their
yeah,
own. What are you going to be a city for your dogs or what are you? And
it's
for so many
impossible.
years they continue like this.
Yeah,
That's just stupid. And at one point of time they are going to sell those puppies. I can
yes,
guarantee
yes,
you that.
yes.
So
So
it's
because you
like.
are spending so much money on the expenses, right? So you will want to, like, it's natural for you to think along
So
those lines.
So I
So, but
think
that's not
many
right.
people are, many pet parents are scared about it because they are like told about the risks. The risks are inflated and presented before them. So I also saw somebody talking that neutering or spaying them causes cancer. So this is something very new that I read, and
Okay.
I was like, "Ki, how is it possible? And
Yeah,
what are you saying?
I don't,
Without a like a uterus, how is spirometer going to
yeah.
happen?" So,
So I don't think cancer will happen.
Array
Joint
for everything
issues,
now, cancer is one cool term people
ah,
pick up, and they just throw it. Ye mat
I
khao
mean,
cancer, ye mat
you
khao
have
cancer.
lesser organs to have cancer. I don't think that's a logical argument at all. At least if you're speaking about joint diseases, bone diseases, then I would still want to have this discussion about, cancer. And Suri's parent has mentioned about TVT, so transmissible venereal tumors. The number of golden retriever females that I've seen with, so there's one, I don't know who it is. There's one particular breeder in Kormangla who's breeding his male dog, and every female dog that has mated with this dog has come back with a TVT.
Oh my
And the owners are absolutely
God.
not ready. So TVT is a tumor. It looks like a cauliflower. It's a growth. It is
It's
cancer. So that
that
happens.
papilloma
Yes,
that looks
yes.
right.
But it works like only you can only, and it's in the tract. So it can happen in the tract. It can happen in the nasal
Oh
cavity,
my
like even the
God.
mouth. So wherever the cells come in contact with, TVTs can happen there. So that too, you will be reducing that also, because if you are neutered your dog, there is no need for you to breed at all. So they will not breed. So there is no chance of TVT. So coming back to, neutering them will cause tumors. That is not something that I have read anywhere. I have not, luckily, not come across a reel like that. But bone and joint diseases, yes. And like I mentioned, that's the reason you need to make sure that you're neutering your pet at the right age.
Right age,
If you're
yeah.
not doing it, then yes, then
So
please have a
maybe if you could
discussion with the
just
vet.
address the risks and how we can manage them, then maybe people will understand better that okay, these risks
So,
are stated, but how you
so
can
the
like
risk
bypass them.
is, the risk is that beyond 6 months of age, there will be risk of mammary tumor, but everything else is removed. And again, mammary tumors, if we find out at a very young age, like a very small size, dogs may especially, we will be able to take care of it. without letting it get too aggressive. That is one advantage. So the second thing that is actually a thing is they can become a little obese. I'll tell you why. It's because once you remove the sex hormones, the metabolic rate does come down.
Hmm.
Okay, so but I have seen, like, luckily, I've had very good pet parents who all of their pets post-neutering have done excellent. Okay,
My
they're
dog
able to.
lost weight after spaying, so
What happens?
forget
What
about
happens?
gaining. You just have to do diet
Yes.
control. How hard is that?
Yes, so you need to make sure that you give them the right diet, you give them the right exercise, and they will be absolutely fine. So that's the only. So you need to put in little extra effort for the first 2 months to make sure that they don't put on weight, and then just maintain that. That's all.
Hmm.
Nothing else that you need to do. There's anesthetic risk is always there. So have a thorough checkup done
Good
before the
vet,
surgery.
mainly
Yes, good
trusted
vet,
vet.
somebody you trust. Like
Exactly.
you have to do it at a time that you are comfortable doing, you are confident to get it done. Because I don't know if it's like a superstitious thing, but I believe that if the pet parent is not ready, there will be something wrong with the pet. Like something will go wrong. So unless it's like if some pet parent comes to me half-minded, half-hearted, and they're like, "Doc, should we do it today?" I'll be like, "If you don't want to do it today, we'll not do it today." Look, if you
Be
have it,
confident
if you're
in
anxious, you
that and
will
come.
project.
Yeah.
Yes, if you are underconfident, if you are anxious, you will project it onto your pet, and that will affect their recovery because you are sitting stressing, and then your pet is looking at you and they come out of anesthesia and they're looking at you stressed and they're like, "Oh, what is happening?" That should not
They
be
pick
there. So
up
we
feelings and emotions so well. Yeah.
absolutely, absolutely. Yes. So find a good vet, get a thorough checkup done. So recently, I don't know where this is happening, why this is happening, but we've had a couple of calls to the clinic wherein people are asking like, why do you need to do blood tests? Like previously, whenever we did this thing, we never did blood tests and all of that. Our vet used to do. I'm sorry, but when everything else is developing and
Exactly.
improving, why shouldn't we do it? Like if there is a better way to do this, like say I do the surgery, like your pet looks good but and very young, so they will be able to hide things very well. So what if I put them under anesthesia and then realize that they're not able to eliminate the anesthetic via the kidneys?
Hmm.
Okay, so that is not a risk that I want to be taking, that is not a risk that I want to put your pet under.
Hmm.
So blood test, a thorough checkup is absolutely necessary. Please don't try to think about, saving some $500 on, say, the blood work.
Very
Absolutely
important.
necessary. Yes, very important
And not
because then you
cheaping out
also,
on the vet also,
yeah,
that
yeah,
I
yeah,
have seen people with this habit. There
yeah,
was one, I won't say a friend, but just a person who was connected in IG community. She went to probably 10 vets in Bangalore just to
pricing.
compare ki
Huh.
which is the cheapest charges, which vet is
Yeah.
taking the cheapest charges for spaying a female dog. I gave her peace of my mind that, are you
Huh.
kidding me? Will you go and compare it in
Yeah.
ki Fortis Apollo or some local vet, doctor who is charging less? I will only get surgery done.
Yeah.
No, right? You are going
No,
to
no.
choose the best and
Yes.
most experienced
See,
person.
if you think something is too expensive, ask them why it is expensive.
Yeah,
So if you come to our clinic and you ask me like why is it? Because I have the confidence to
exactly.
reverse my sedation. I
Experience,
have the
it
yes,
matters.
I
Yeah.
am experienced. I have a team that can deal with anesthetic emergencies. I can reverse your sedation and we use gas anesthesia. We make do a thorough checkup before and after the procedure. We keep them
Hmm.
throughout the day. So there's so many. So when you listen to why they are charging more, like if say somebody is saying that, no, I don't know, like I want to charge more, I will charge more, and they're just sending your pet back without them recovering, they're still sleeping and all of that. I'm not okay with that. Please don't go there. But if your vet is confident they're doing it the right way, they're making sure that your pet recovers properly and then sending them home, then you should be able. Because see, it's not just about the procedure, right? It's
Hmm.
taking so much time off the vet. It's taking so much.
Exactly.
There's so much that goes on behind the closed doors, like so cheap affair. Like it's actually pricey. So we need to make sure that we're doing the best for our pet. If you're not able to afford, I'm not shaming you. Please get it done at a reasonable place. There are ABC centers. There are people who do this at a lower price. Please get it done there. But don't compromise if you're able to afford it.
Yeah.
Yeah.
Plus, what I always suggest people who, like, I have discussions with, ki, talk to pet parents who have gotten it done, from which
Yes.
vet they have gotten it
Yes.
done, what feedback they have. And, because anyway, it's like for all jobs, right? Even in our jobs,
Yeah.
with experience, packages increase. So that's very much like very feasible and normal.
Yeah.
So this cheaping out on vets is something that I
Yeah.
hate when people say ki do that vet charges a lot, this vet charges less. Arey to see why? Because that they might be having
Exactly.
better
Why?
experience. They must be specialized in those
Yeah.
surgeries. I think for this though we have covered so many questions in just one. So yeah, risk as you said, because of these risks, people should not be discouraged to
No, no.
not get it
These
done
are
yet.
not at all reasons that you should cite to say that no, I don't want to neuter my pet. But if you have like a genuine reason, like some
Yeah,
pets
some health
will need,
issues,
yeah,
yeah.
health issues, and that's the reason we cannot neuter them, then absolutely fine. And in those cases, I think I'll just address that question also. So what you need to do in those cases is make sure that you get routine checks done. Abdominal scans are very important in those cases because abdominal scans may, in case there's like a small nodule or something that we're able to pick up, luckily, especially the prostate we'll be able to see very well. So it's a male dog. Unfortunately, cancer can happen at any time. So there's no one short way of saying that, this is how we will ensure that there's no cancer. But what you can do to understand if something is changing. So every 6 months, if your dog is a senior dog, so post 6 years, just get it done once in 6 months. But if it's less than 6 months, 6 years, then once a year at least, get it done. So know the basic values of your pet, the blood work and
Hmm.
all of that. And that should help, in those cases, we should make exceptions.
True.
Yeah.
So, because I have heard a lot of pet parents saying that my dog has hip dysplasia, that's why I'm not getting them sterilized. So, is
Mm.
that like hip
That is,
dysplasia? Should it be
no, no, no.
considered for not?
If hip dysplasia, like I was saying, it's a developmental disorder. Once they've achieved their bone and joint development completed, that stage is complete, then there's nothing that the hormones are doing. That's the reason we say beyond this age, like say retriever post 16, 18 months, and like a bigger dog, like a Saint Bernard post 2 years of age is when we will neuter. Hip dysplasia is not a reason. Like once they've reached maturity, that's not a reason for you to not neuter your dog.
Right.
But so
So,
that's what. So
this is
people,
something that many pet parents need to get cleared in
yeah,
their
I
head
think they
because,
get confused.
yeah, because
Yeah.
so many dogs have hip dysplasia these days,
Huh.
and all those pet parents, most of them are under this impression that because he has hip dysplasia, so I will not neuter that dog.
Yeah, yeah. No, no,
So,
no. That is not necessary. It's not need. Once the development is done, it's done. There's nothing that you can do about it. Okay, so that's the reason. Like, if you can diagnose it at a very young age, hip dysplasia, then please get it done. That one sedation, if it's especially if it's reversible or not, it'll hardly take 15, 20 minutes for your pet to get up and walk again. So if you have that idea, like, this is what, so then you will be able to, in case you need to extend a little bit more, like say another 6 months you need to extend, you will be able to extend. But don't take that risk of, I will not neuter at all because that's the confusion. Like you don't have full knowledge. So sit down, maybe
absolutely. This is the
read some
gap
good
that
article.
needs to
Yes,
be,
yes,
filled. Yeah. So
yeah,
I think for this, too, we have covered everything because, yeah, only that one health issue thing was there.
hmm,
That because that's some health issue that I have not heard of. So that the question is that for health reasons, I need to keep my male dog
yes, yes.
intact. What are the precautions or tests for cancer prevention?
Huh,
So I asked them that what is the health issue
hmm,
because you should be
yes,
specific, like what health
yes,
issue. So the pet parent said that cow hawk outward. I don't
yeah.
know what this
So
is.
basically, the legs will look like this, like they'll
Okay.
be outward, like
Yeah,
this.
yeah, yeah. Okay.
So
So he's a rescue, so
don't
parents
know the
not known.
parents.
He has a slight slope and weak back limbs. He's undergoing gallon myotherapy and some other different therapies, body conditioning, and awareness drills 5-10 minutes every day. We were advised not to neuter him. Can you provide some insight on this?
Yeah, so this is an exceptional
Hmm.
case. So in this case, like I was saying, get regular X-rays done, make sure that we get the what was I saying? Ultrasound scans also done. Okay, that is something that I think. Oh, sorry, I think what people are talking about. Sorry, I just remembered. When people say that when they neuter their dog and they get cancer, I think they're talking about the bone cancer. I think so
Hmm.
because it's very common in like Rottweilers. Okay, but that's also like a breed issue. So
Breeding
if
also,
that is,
like bad breeding.
ah,
Yeah.
bad breeding. If their parents were predisposed, the dog will also be predisposed. But that should not be a cause for you to. If they're
Because
talking
that
about
can happen
osteosarcoma,
irrespective of
irrespective, yes, yes, yes.
sterilization, right?
But
That's
there
what
are
I don't understand.
very limited data.
Why are you relating it
Yes.
to this? That
So
can
there's very
happen.
limited data on osteosarcoma. I think now I just suddenly remembered that is another because they mentioned about the bones and all, no? That could be the tumor that they're talking about, but that shouldn't really, because of the incidence and the research, the documented data is so little on that. So that should not be a cause of concern. But here, yeah, like I was saying, you can get your, what was I saying, like blood work done to make sure that there's nothing, like say some tumors, if they're in the kidney or liver and all, the values will be elevated. So those you can look for. Abdominal scans and chest x-rays and abdominal x-rays. Please get those done.
So for cancer prevention, as she has mentioned, what are the precautions or tests for cancer prevention?
So like blood work to make sure that liver and kidneys are not affected or anything. Prostate, to check prostate, one like a physical exam also we will be able to palpate the prostate and check. But otherwise a scan, a detailed scan. And if you're able to put your dog under anesthesia, if you have some doubts, then put them under anesthesia and get a CT scan done. So that would be a better way to go about it.
So, like Surya has asked, like, are there any things to watch out, like markers in the blood test? What I
So
got done
some,
because when we got that lymph node scare, so we saw that monocytes
yes,
value
yes.
was there to watch out for.
So that's what. So in the blood test, what you would be seeing is if it's like a lymphoma thing, then you would see high numbers of those. In some cases, we don't know if it's like a documented data, but GGT is one liver parameter. So that is elevated in some of the cases. Calcium is something that would be elevated, but don't freak out if you just find out on a regular check that calcium is elevated, because that is regular calcium. So that we need to look at ionized calcium. So if you feel that the calcium is high and like there's no explainable reason for that, like no diet pet, it's not excess, we're not supplementing the pet or anything, then ionized calcium needs to be checked. Then we will be able to assess and understand if that is happening. So these are things that you can look out. Calcium especially usually in like adenocarcinoma, like in the anal gland region, some tumors happen. All of those usually calcium. Usually in tumors, calcium will increase.
Since you mentioned anal glands, I've just wanted to ask, like, anal sac cleaning, right? Not all dogs are able to do it on
Yes,
their own, especially
yes,
small breeds. I've seen they're not able
yeah.
to, because pennies, so we have to get it cleaned every like 2 months, or maybe sometimes so after a
Every
month and
month.
a half only. So how often do you suggest like people should get, and under the hands of a vet only, I would say,
Yeah.
not try on their own here.
So the problem is previously what we were doing is we were putting our fingers on the inside and then we were expressing and all of that. I have taught a couple of parents to express it from the outside, but that is like I make sure that they do it in front of me,
Because
show it
it
to me,
can
and then do it.
cause severe
Yes,
injury.
yes, it can cause injuries. So if I feel that's the reason I don't tell anybody to put their finger and then squeeze. That will they will definitely do it. Again, this again depends on how bad this thing is. Like I have pets who come every 2 weeks for just sac cleaning because it fills also so much. But some like Penny, once in 2 months, once in 3 months, that can
So what
also
are
be there.
the
You need to
signs
look out
like it's
signs.
filled?
Huh.
Hmm.
So would be they start off licking that area a little too much. That's how it will
Pain, yeah.
start off, and then scooting will be there. You will have some smell that that you will
Yeah.
notice that smell. There's definitely
Oh my
there's no
God.
way you'll miss that smell. Yeah, that's the worst thing. And if there's like a enlargement in that area, you will also notice that that area looks a little more blob like.
And
So those are
they
symptoms.
tend to bite also,
Yeah, that's
that
what. So
area. Yeah.
licking, biting, itching, because they want to
Yeah.
express it, but they're not able to. So that's natural. You can just get it. Unless there's an infection, you don't have to worry about anal glands at all. It's okay to get it expressed.
Yeah. Okay, so there was one question. Can you please shed some light on bone spurs, its remedies and management?
Huh. Bone spurs, I think they're talking about the vertebral, the spondylosis thing. Bone spurs, unfortunately, there's nothing that you can do to prevent them from happening. It's basically a degenerative lesion that happens. It's better to diagnose it early so you'll be able to manage your pet and understand what needs to be done. Again, here also, X-ray may you will be able to clearly see. So once a year, if you're getting X-rays done, then you will be definitely be able to see if there's any development, it's getting worse and all of that. Once you understand that your pet has this, look out for symptoms. Management of weight, that is absolutely important because again, these patients also eventually when it gets very, very bad, they will not be able to get up at all. So they will the spine compressors and all of that. So there will be pain. So we need to maintain with pain relief. We need to sometimes keep on a low dose of steroid, pain relief and all of that. That's what you will be able to do. Quality of life is what is important in spondylosis cases. So very rarely they will start to lose control of their bladder and all of that. But usually it's basically them not being able to get up and stand by themselves, just lying on one side, things like that. But early diagnosis will prepare you to kind of keep them on an anti-inflammatory, slow the progress, not necessarily, stop anything from happening, but slowing the progress is what we can try and do. That's all.
So there was
But
one question about you mentioned like incontinence. So like that's also one side effect of spaying in female dogs mainly, I
that
think.
happens if you spay them. That's again dependent on breed. Large breeds, that's because the sphincter is not completely developed. That is the reason it happens. So, like say, like a indie dog also, we have seen some indie dogs whose parents were big indie, like large indie dogs. If because the ABC people pick them up and you do the neutering at a very young age, like four,
Yeah,
5 months, may they will do it.
yeah.
Then because the sphincter is not developed, then it could happen. But if you have a owned dog, you would be able to understand. Like we will be monitoring their progress, like the development and all. Then the chances are very, very less. I've not seen unless like we've monitored and done the spaying at the right age. I don't think we've seen any case
So,
of
and
this
if
sort.
in case the dog develops this after
Yes.
sterilization, then what other like measures
So
to take to manage it better?
So one, we need to first understand if it is actually incontinence because dribbling can happen even in UTIs. Okay, so we understand why this is happening. So we do a routine urine check and all of that, and out of them come clear. Then we understand it is incontinence. There is DES. DES is it's an estrogen supplement, so it's hormone basically because the sphincter needs it. We can get the pet to get onto the hormone supplementation. There's also another medication, but unfortunately, it's not available in India. So we have had cases where we've given out prescriptions and parents have tried to get it from abroad. But off late, recently, one of my clients, she wanted to try it for her pet who had incontinence, but she developed it at like, I think, 4 years of age. She's not too young or anything. But they were not able to procure it even from the US and Dubai. So both places they tried. So DES works very well. So we start off with like 2, 3 drops of the medication only. And once we start with this, we do a 3-day course and then once a week for about a couple of weeks. And then
Hmm.
we tell them to do it only when they see the incontinence. And we usually see that it improves very much, like a lot of improvement will be seen. The only disadvantage would be that this has an effect on the bone marrow. So we might see that if like long-term use there is some suppression of bone marrow. In those cases, again, we need to routinely check their CBC.
Main thing
That's
I
something.
think it all boils down to this that frequent checks are important.
Frequent checks are
Not
important.
neglecting
Yes.
signs, and if you're frequently keeping a tab on your dog's health, you will anyway
Yes.
catch things very
Yes.
early. So
Yes.
that is the basis. Instead of getting scared about all this, just focus
Yeah.
on that. So, and
Yeah.
I think there's one Himalayan Aphrodite something tablet
Yes. So
also
that
comes.
is nephrotic.
It's like
That's
a
a kidney
natural
supplement.
Ayurvedic,
Yes. Yes.
yeah.
So that's more like a kidney supplement. It
Hmm.
doesn't necessarily. That's what. If we thought it was incontinence and nephrotic has worked, then it means that it was not an incontinence. It was something related to the kidneys.
Hmm.
So that's how we differentiate.
Okay.
Yeah. But we'll be able to understand.
So one last question was on like two small questions are there. Regarding dental health. You already told like how
Yeah. Yeah.
to maintain that and how important dental scaling
Yeah.
is.
Very important. So if you've gotten to a point of dental scaling, that means that nothing else is going to work. So there are like we have cases where it's like a grade 1 tartar or just food staining that we've seen, and we've told parents to start off with bone chews or frozen carrots can be given as chews, something to chew on. But again, these need to be done under supervision or routine brushing, regular brushing. So when we tell people that they need to brush their dog's teeth, they think that once a week, once a month is enough. That does not suffice. You have to brush their teeth at least 5 times a day. It's basically like you are brushing your teeth. You have to do it so many times. But if that is a task which I understand, then you can also look out for supplements or sprays. So more than spray, so you have dental sprays that you can
Hmm.
just spray on their
Are they
teeth.
effective? Because
So they're
I
not
brought one,
very
but
effective.
uh,
Yeah, and also these take a lot of time. But something that I've actually seen works is the pluck of powder.
Hmm.
All my cats are on that, and 3.5 years into it, none of them have had to have like a dental scale or
So
anything.
there's one
And that
canine
actually
powder
works.
also that's very popular. That also works.
Hmm.
Like a supplement.
Okay.
That's also a powder that
Yes.
works.
I don't think I know the name, but if it's work, it works because this powder also works very well. It might take like 3 weeks for you to start noticing results. So if you've gotten to a stage where you've had to do a dental cleaning, then post like a scaling. Post that, please keep them on something. Either brush their teeth, but if your dog is too if it's an adult dog and they won't let you do it now, then at least consider like a supplement or spray, or you also get wipes. So a good dental wipe also can work. It's very important. Like there's no
And
doubt
how
that
do we like
it's
identify only a vet can, right? That my dog needs dental scaling.
so you will start to so usually what happens, we will see the front part of their teeth like at home. So always take the back ones, and so the gums, there will be like a red line where the teeth tooth and the gums meet. If there's like a bright red thick line, that means that there's gingivitis. And on the tooth you will see like a cemented thing sitting. Okay. So if it's just like a yellow stain, then it means you still have time. But if there's already like a plaque sitting there, you will understand. But confirm it with a vet, because usually, recently also we had a patient who came in and they thought they needed a scaling, but we were able to kind of just manage with supplement. So just talk to the vet. They will be able to help you better, but usually you will also understand if there's like a lot of smell and discoloration of teeth. That is another very important thing. If your dog's tooth looks gray or red, that means there's something going on inside. So that tooth
Hmm.
might need to come off. So again, talk to your vet about that. There could be an infection.
Gingivitis, I think drooling also because
In
our
drooling,
community
yes.
cat had
Yes, yes.
sadly passed
Cats
away.
cats
Yeah, so
very
she
common.
passed away. She was hard to catch. She was a community cat. She
Hmm.
had severe gingivitis and she would drool all
Oh,
the time. So many times, we called catchers, but they were not able to catch her, and
hmm.
she suddenly, sadly passed away.
Yeah.
So cats, it's very common. What I got to
It's
know,
very
like
common. It's very
yeah,
common.
because for cats, how do you cannot
I
clean the teeth, right?
it's very rarely you have a cat who's
Yeah.
compliant with cleaning. So that's the reason they're on supplement.
Hmm.
So so I told you, right? That I've not had to scale my cat still now. So luckily, because I've kept them, like, once they lost their baby teeth and they had their adult teeth come in, I started them off on the supplement. And that's worked very well. And it's worked for a lot of
Hmm.
patients. And that's the reason I know that this works. Sprays, some it might work, some it might not work. But brushing again, if you can, please
And,
do that. That would be
and
very good.
bone chews with
Bone
good.
chews. Chews are very good. Very good.
Just one last
Yes, yes.
question about deworming. You already addressed
Hmm.
it. So if you could just shed light how important
Hmm.
deworming is, why people should not skip their deworming their pets, and like how frequently. Frequently, I think you already addressed, but maybe just
So frequency I've already told. So puppies may up to the age of 3 months, once in 15 days. After up to 6 months, once a month, and then post 6 months for once in 3 months for life. This is very important because you might think that, oh, I'm not exposing my pet to anything, like, they're on home food, I'm cooking their food and all of that. But still, when they go out on a walk, they could pick up on something. They could be exposed. Like you're also at risk of getting exposed to the worms that they have. They could also cause very severe deficiencies in pets. Worms can just stay in the body for very long, especially tapeworms, which is scary. Lot of other health issues can happen, and it can be transferred by even just like a flea can transmit eggs of
to
the yes. So it's very important that deworming is not skipped, and it's a simple thing. It's not having any side effect on your pet's health. It's one of the easiest things that you can
the
do
the
to kind of.
only argument I heard against this was that it imbalances the gut. It kills the gut bacteria, good
No,
bacteria.
no, no. See, it does not have an antibiotic.
Hmm.
How is it going to
Yeah.
kill the bacteria?
That's why I wanted people to
No, no,
hear
no.
from you
So if
why
you,
it's baseless.
it's natural for your pet to have probably a small loosey bout post
Hmm.
like a day or two post that, but it's absolutely fine. And if you find live worms, just talk to your vet. We might sometimes want to repeat it maybe the next day or like 2 weeks post that, but otherwise no side effects. No side effects to
I
happen. So I
think
think
non-deworming
a
has
lot.
far
Yes,
bigger
yes, yes.
scares
Because
because I remember reading on a Facebook group. the dog passed away
Yeah,
because
it can.
it went unnoticed. They were using the natural powders and they were not deworming.
Huh.
I think they were not even using anything. They just
Huh.
added that pumpkin seed powder. That's it. That's all that was added, and the dog eventually passed away with prolonged illness.
Yeah,
So
so
that's very bad.
chronic illnesses because like no nutrition will be available to your pet at all, and they can cause anemia. They can cause severe anemia, severe imbalances in their
Dehydration, the
nutrition. Yeah,
bad,
a
yeah.
lot of things, dehydration, like diarrhea, all of these things, and some of them can affect your pet's brain also. So why risk it? This is the simplest thing you can do for your pet.
So thank you so much, Dr.
No
Archie.
worries.
I don't even want to see what time we have crossed, but I think everybody is blown away by this
No,
session.
I'm
So,
glad if it
so,
was
so
helpful.
informative. We'll just quickly take like
Yes,
few some important questions which we might have
yes.
not addressed. Oh my God. I remember there was one from
Yes,
Nutkit
yes.
somewhere.
About struvite crystals.
Yeah,
Yeah,
yeah, yeah,
any
yeah.
information on struvite crystals? So basically, this happens when there is imbalance in the pH of the urine. So if there's a more alkaline urine is when this would happen. Easy to diagnose with just a urine check. So when we centrifuge the urine and check the sediments, we will be able to look at the crystals very clearly. We'll have to either, if it's very minimal, unless they've formed like stones, we will be able to use just a pH balancer, like a supplement like Euro Support can be used to take care of it. And we need to just make sure that we regularly check. But if there are already stones that have formed, ideally we need to keep them on the diet because this diet will act as an acidifier and shrink the stones. Sometimes these can come down and block the urethra, so we might need to do surgery. So please don't let it get to that stage. So ideally, when you do a routine test, you will anyway find this out. So basically, pH balance and food may be if you're feeding too alkaline food, not feeding enough proteins and all of that is when this could be happening. So that is
Then
one thing.
there was one question, how do we determine sterilization for community pets? Like it's difficult to determine their age.
Yeah, so they usually indie dogs, it's okay. That's the reason I said, like, even these urethral sphincter issues also happen more in them because we cannot take that risk of, and I've not seen in an indie dog, like a stray dog who's had this issue, luckily. So we cannot, like, at 6 months before their first heat, if you're able to, because you're removing the, issue of mammary tumor also.
Yeah,
So might as
plus
well get it done.
their chances of getting
Yes,
impregnated is
yes,
like
very high.
uncertain. You will not even get to know when that happens.
Yes, yes. So that's there we'll have to take a small
Oh
risk of neutering them.
my God, what happened?
The
Did I put a
filter is on.
filter?
We have an option.
Uh,
Oh yeah, 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 we have an
oh
option.
God. Yeah, so and one more thing, like how do we, is there a way to determine like whether a community dog is, and apart from that BBMP stamp that they put, clipping that they
Mm,
do. So is
no,
there
no.
a way? No, right? Like for
Female
male
dogs,
dogs you can,
no,
but in
yeah.
female dogs,
Female,
unless
no.
you check for an incision, I don't think there's a way, right?
Incision also after a while it will not look like you've ever opened the dog. The hair grows back, and because they're also neutered at such a young age, they grow right post that, so you'll not be able to. So, like my female cat, she was actually in Jaipur, and the vet there, even though she was owned, he's made that cut. So that's the only thing that you can rely on.
I don't know, I'm remembering there was one very important question. I hope I'm not.
Angel also had asked something.
That's regarding the diet. I think that is like for that, I think it differs from dog to dog, right? It cannot be generic. Your
Huh.
dog's weight and
No,
age
no.
and
So the
everything.
meals should not
Hmm.
reduce. The amount of carbs that we give them should reduce. Protein should be adequate. So again, depending on what stage of aging your dog is at, so Angel can now continue to have the same amount. So fiber, we'll have to increase the bulk for the bulk of it because otherwise it doesn't make sense that you cut down and starve your dog. Then they will develop vices. They'll start chewing things, all of that. But otherwise, there's like again, depending on the age and the activity of the pet
Hmm.
also,
Yeah.
a lot of things will depend.
So there was, yeah, regarding spaying and neutering,
Mm.
one very good question. Like, are there any alternative procedures available in India, like the laparoscopic surgery?
India,
Because I
so
don't think it's
laparoscopy
very
also,
common in.
So
India, right?
no, no, no. So laparoscopy also, we're neutering them. Like basically we're removing the ovaries. So it's not like we're not doing it. And if you want to get vasectomy done in your male dog, then it becomes pointless. Like if you're like how in tubectomy or vasectomy in humans, what we do, because we are trying to remove the hormone to make sure that none of the side effects happen. Sorry, if you continue to keep the organ that is producing the hormones, then it
Exactly.
doesn't make sense at all. The I don't know if it's available here, but they do have like implants that they put in female cats and I think male dogs. I don't know if we have
Chemical
it.
castration
Chemical,
is
yeah,
also
but
there.
it's also very short-lived. It's not like a long-term solution. So I think you have to repeat it every 6 to 12 months or something. That's basically like your hormone suppressor. So it does not let the body produce enough hormones. But I mean, the organ is still there. So whatever can develop will develop. So these are the options, but then you will only be limiting the chances of pregnancy. The other things that we've discussed, like pseudo pregnancy and all of that, will still be there. That we cannot do anything.
Okay, so I think I've broken all records for the longest live session ever. If there is a prize, I'm going to win it.
Oh,
But
sorry, sorry, sorry. I'm so sorry.
yeah,
There's this one person, I think the Chomko has asked, muting a 7 to 8 year old dog with dilated heart. If the vet is confident about the anesthetic, we recently did a like wart removal, eyelid tumor, and dental scaling on a dog. He was 13 years old and he had a heart murmur and all of that. The anesthesia, that's where the risk is. There's no risk with neutering the pet. But general anesthetic, if the vet is confident about and you do a thorough checkup with everything and make sure the meds are in, then there's no problem with that. I'm so sorry I cut you off.
no,
I'm
no,
so
no,
sorry.
please. We are here to answer as many questions. So I think we've covered everything. But
Yeah.
seriously, Dr. Archana, we need to have that session on tick
Tick
fever
fever.
because that requires a whole hour to talk about.
Yes,
People are
yes.
so scared and clueless and they don't know, all mixed opinions there are there.
Yeah.
So thank you so much for
No, no
agreeing to
worries
do this. And
at all.
I know you have to like go to work so early, and it's like
No, no,
you took
it's
out
okay. I
time.
actually
And
enjoyed this.
yeah,
It
I
didn't
was
feel like
so
I was live or
excited.
anything. It
Yeah,
was like I was talking to one of
two
my
people
pet
asked
friends.
this. Could you reshare the dental health powder
Oh,
recommendation? What
plug off.
do you
Plug
recommend?
off. Can I just type it here
Yeah,
now?
yeah, yeah. Type it.
And the dose is also so less with this powder, and it's usually very tasteless and smell odorless and all that. So even like cats take it very readily. So this is something that I can vouch for.
And I've also heard about Canident. So if anybody wants to
Ha,
explore
can
that,
well,
Canident
yes,
powder is also there by Dogs First. So that's also very good powder. So yeah, these dental powders. Then we have brushing, regular brushing,
brushing,
and bones,
bones,
but
yeah,
monitored teeth.
monitor, yeah,
And based on their size, it's not like a
yeah,
big bone for a small dog that way.
smaller,
Thank you so
yeah.
much, Dr. Archana. I'm so
No, no,
sorry I
it
took
was my
you such,
pleasure.
but I'm so happy people like Suri and
Yeah,
others, they're
see
stuck
till the
till
end.
the end and ask questions. I'm
Thank you
so
so much.
happy.
I would want to see Suri. Suri is like an indie, right?
Yeah,
Is he?
Suri is amazing. Suri is
Okay.
Suri.
I want to see Suri now. I will go stalk Suri.
Yeah.
Okay.
So she takes care
Thank you.
of, so I think Suri, I will guess how many, for 30, 40
Oh my
dogs,
God.
community dogs, and she's
Oh, that
amazing. She's
is in
doing,
Bangalore.
yeah, no, no, in Hyderabad. So she's
Oh,
doing like amazing stuff for community animal welfare,
okay.
and hats off. So she's also an entrepreneur, so her treats are amazing. Like
Okay.
she's a puppet treats, and you can check her out and stock. I
Yes,
promoted
yes.
Suri.
Yes.
Thank
I
you
will go
so
there.
much,
Thank
Fifi,
you.
Suri, two constants in even
Yeah.
Apurva, and so many of you have
Thank you
stayed till the end.
so much.
I'm so happy.
That's
Hey, cutie pie!
He's
Special
hungry.
appearance!
He's very, very hungry and cranky now. He lives for food, basically.
Mine is so passed out now.
The
Some
other, I don't know where the girl is.
Hello,
She is somewhere.
hello.
Penny,
Say hi, at least it's your page, damn it.
Penny, Penny. She's like,
Passed out.
don't care. My food is late.
So I fed her early today. Whenever I
And
have
even
sessions,
anyway,
I
a
feed
spare
her
human,
after
no?
7.
So I don't think she cares.
Yeah. Thank you so much, Dr. Archana.
Thank
I'll
you.
save this session so
Yeah,
that
please.
as many people, please forward this to as many people as you can, as many pet parents. This is like so important, the most important session that we've had. Because this is some information every pet parent must know so
Yeah.
that they're able to take better decisions. And thank you for being so amazing.
Thank you.
Good
No, thank
night.
you.
Bye
Thanks for
bye.
having me.
Thanks a
Bye.
lot.
Good night.